call the January 9th, 2025 agenda session to order and welcome everyone here and those listening online as well. Before we move to the invocation, just wanted to take a moment of silence to remember President Jimmy Carter, who is being memorialized today. If we could just take a moment of silence. Thank you. Commissioner Adams, turn to you for the invocation.
Dear Heavenly Father, we come today just saying thank you. Thank you for this wonderful day. Thank you for the life of our late President Jimmy Carter. Father, we'd ask you to bless everyone in this room. We'd ask you to wrap your arms around them in loving care. Father, we ask you that this meeting be done decent and in order. In Jesus' name we pray. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Before we move forward, just let Commissioner Council is on by phone, and Vice Chairwoman Jones should be here in the next 2 to 5 minutes. She's making her way up. We'll go ahead and move to the approval of the agenda. County Manager, any changes for the agenda?
No, Chairman, Divya, there are no changes to the agenda.
Commissioners, any other requested changes? Call for a motion.
Make a motion to approve the agenda, Mr. Chairman.
Second. There's been a motion and a second to approve the agenda. All in favor, raise your right hand.
Unanimous. Commissioner Council's offline, so I was trying to reach her again.
Okay, thank you. We'll go ahead and move to the presentations. Presentation A, fiscal year ended June 30, 2024, audit results presented by Cherry Beckett LLP. County Manager Griff.
Yes, April Adams Assurance Services partner with Cherry Beckett will present this item along with Robin Kuntz, Finance Director, Chief Financial Officer, and we present the results of the fiscal year audit. Come on. And then you'll answer any questions that you may have.
Good afternoon. It's my pleasure today to introduce to you April Adams. She is our partner with Cherry Beckett Holland and led the audit for the county this fiscal year with her team, which comprised Linda Suggs and Chris Thomas. So anyway, they have the results for the audit for you. She has a presentation. You'll find that on your in front of you on your desk. You can flip through. But just quickly, we did submit our audit report to the LGC on December 13th, which was a timely submission. And I do just want to take a second to say thank you to April and her team. We had a lot of changeover and a lot of new people doing things on the audit this year in finance, and they were very supportive of us, and we just want to show our gratitude for that. But I'll turn it over to April.
All right, I am excited to be here to deliver the results of the June 30th, 2024 financial statement audit. Here's what I'd like to cover with you this afternoon. This is a lengthy agenda, but I promise you we'll move through it pretty quickly. The first slide really just introduces the team from Cherry Beckett, but also reiterates the point that we are hired by you, the Board of Governors, and we do report to you, even though most of the audit is conducted with the resources of your employees throughout the county. But we are committed to report to you, and that is the purpose of this presentation today. Obviously, I'll cover the results of the audit. I'll talk a little bit about internal controls, and that includes the audit of the single audit. Those are the federal and state dollars that the county administers, and we are hired to audit the compliance of those programs. And so we'll talk about that. We'll talk about internal controls and how they're a part of our audit and how we report on those to you. Then we'll talk about if there was any corrected or uncorrected misstatements. That's also known as audit adjustments. I'll reconfirm our independence as your external audit firm, and then I've just got a whole bunch of other required communications that we'll cover throughout the presentation. All right, so first up, first slide, again, this is just reiterating that we are reporting to you, the Board of Commissioners. I am the engagement director, and that means that I'm the one on behalf of the firm who actually authorizes the signature and the issuance of the opinions themselves. I do set the audit plan with Linda Suggs. She served as the senior manager. We decide what are the audit procedures and how are we going to get all the assurance we need through all the testing, and then she helps execute that with a team of folks from Cherry Bekaert. Also listed on here is Daniel Dougherty. He served as a separate reviewer, and so that's a requirement of our firm for quality control, that every person that issues an audit also has someone of equal level review that audit to ensure that we adhere to the standards and the quality that the firm expects. And so Daniel Dougherty served as that role this year. All right, so the results of the audit itself, we did conduct your audit under two different accounting or auditing standards. First is just the generally accepted auditing standards of the United States, so any entity of any type would get the audit performed under those standards. And then we had a second level of auditing standards, and that's specific to governments, as you're a government entity. So that requires us to issue two separate opinions, one for each audit standard. Both opinions that we issued were what we considered unmodified opinions. Those are the best results that you can get, an opinion that you can get, where we are assuring you it's the highest level of assurance we can give you as an audit firm that your financial statements are free from material misstatement. As I mentioned, we also perform what we call a single audit, and so those are over the federal and state dollars that the county administers, and because there are two different levels of grant dollars, we issue two separate opinions, one for federal and one for state. Both of those opinions are also unmodified opinions, so all four opinions given were unmodified, best results that you can get, so congratulations on that. All right, just to dive in a little bit deeper on the single audit side, it is quite a bit of work. It's almost half of what the audit consists of. As you can see, these are all what we consider the major programs this year. These are the programs that we did a deep dive on and tested for the 14 different compliance requirements that might be direct and material. And so you'll see that there was quite a few. The county has many, many more programs, so these are determined on a rotational basis, but here's the list. Also, state programs as well, cross-cutting in the public school board capital funds, which is actually the lottery dollars that are spent for the school system. So, and their findings were issued related to that. As far as internal controls go, just over the financial statement audit itself, we don't actually issue an opinion on those controls, but we are required to do a lot of work related to the significant transaction cycles. So we do collect all of the policies and procedures related to those significant transaction cycles. And then what we are required to report to you is if we find any significant deficiencies or material weaknesses in those controls that we were looking at. The types of deficiencies that we can issue would be either a material weakness or a significant deficiency. I am happy to report to you that we didn't issue any material weaknesses. We can't say the same exact blanket statement about significant deficiencies because we didn't test all of the controls over the county. And so we just looked at the significant transaction cycle. So we don't give that same blanket assurance and say that there aren't any significant deficiencies, but you can tell from our report we didn't report one. So. Great results. As far as corrected and uncorrected misstatements, again, these are also known as audit adjustments. We are required as your auditor to report to you any adjustments from the time the trial balance is provided to us through the issuance of the audit. I am happy to report that we didn't report any corrected or uncorrected misstatements, which you can take away from that, meaning that all the policies and procedures that your employees are required to follow as far as financial accounting and transactions is actually helping capture all the activity properly throughout the year. All right, the next couple slides talk about qualitative aspects of accounting practices. I'll try to keep it as high level as possible for you. I'm sure that's an exciting topic. But first off, it's just kind of informing you that your significant accounting policies are listed within your footnotes. So if you want to take a look at those within your report, they're all listed there, so you kind of have to get an idea of what all the policies are that are significant to the entity. Typically, for the last 5 or 6 years, we've had a new accounting policy issued every year. Typically, that happens when there's a new accounting standard to be followed. We got kind of a bye year this year where we didn't have any accounting standards to implement that would change our significant accounting policies, so no new policies for this year. We'll switch topics to related party transactions. We are required by the audit standards to actually look for and identify any significant related party transactions or relationships that might exist, and then take a look at those transactions and make sure that they're properly accounted for. We didn't identify any significant related parties that we felt like we needed to test any transactions for. Kind of on the similar lines when it comes to significant unusual transactions, we are looking for those as a part of our audit. Obviously, if they were significant and unusual, there's a chance that management might not be as familiar with the accounting requirements related to those transactions, so you would want us as your auditors to take a look at that to make sure that if there were any significant transactions that they were properly accounted for. We did not note any for the current year. All right, so significant estimates. We do want you to be aware that there are a tremendous amount of estimates within your financial statements. Some of them are very significant, particularly your estimates related to your pension and health insurance for your retirees. Those are pretty big balances on your financial statements and are estimates in themselves. They are prepared by an actuary, but they are based on data provided by your management to the actuary to come up with those numbers. So we take a look at those as a part of our audit procedures, and they are a more high-risk area. And then lastly, just as I mentioned, you've got footnotes to your financial statements. The standards do require us to report to you if we felt like any of those disclosures listed in there are not neutral, consistent, or clear. Basically, I'm not pointing out any of those in particular to you that I don't feel like you couldn't just pick up, read, and understand. So that's all for that. As I mentioned, I'm your external auditor, and so that means that we are required to maintain a level of independence from you. We evaluate that on the front end before we sign the engagement letter and get started, but we do have to think about sometimes when we are your auditor, we're also hired to do something else in conjunction with that audit. Sometimes it could be writing financial statements, it could be preparing the statement collection form. Our firm does assist with the preparation of the financial statements. We actually have a whole separate team that wrote those this year, along with significant involvement from Robin and her team to prepare those, but we do make sure that we keep that level of independence there between the two teams in order to stay independent as your external audit firm. The data collection form is just where we are reporting the results of the federal single audit to the data warehouse, and so we prepare that form, but then Robin reviews it and we both sign off and certify. So those are the only two things we did, so we do feel like we maintained our independence. All right, the next two slides just have a variety of topics that we're required to communicate to you, so we'll breeze right through them. First would be if there was any difficulties in counting during the audit. We didn't have any difficulties to report to you. We also did not have any disagreements with management during the audit. That would make things spicy, but nothing this sort. We also didn't need to consult out any procedures or specialty items to any other accountants during the audit. I did want to bring to your attention that we do obtain what we call a management representation letter. And so what that is things that management has represented to us during the audit that we are relying upon in order to issue our opinion. And so we keep a list of those during the audit, and then we ask at the end that both Clarence and Robin sign it as a part of our assurance and part of our audit evidence. We're not aware that management consulted any other accounting firms for any second opinions on anything. I don't have any other findings or other issues that I feel like I need to bring to your attention that came about during the audit. I do want to point out that while our audit is not designed specifically to look for fraud and illegal acts, we would have to do a much more in-depth look at things, but we are required, if we come across anything like that as a part of our audit, to communicate that to you. Just letting you know that we didn't find anything like that we felt we need to communicate. And then lastly, going concern, the audit standards require us to consider whether we think the county has the ability financially to be here a year from now, and so, or from our report date. And so good news is I do think you guys will be here next year having a similar meeting, so that's great. All right, this slide is really technical. There's a lot of words on this slide, but really what it's trying to just reiterate to you is that we opine on the basic financial statements. So if you think about the core statements that are in front of the footnotes and the footnotes themselves, that's really what our opinion covers in all of the information in that financial report. There are things like the management discussion and analysis. There's some 10-year data related to your pension plan. Those two things we call other required supplementary information. They're required to be in there, but we don't actually extend our opinion over that information. As far as the supplementary information, which is the fund financial statements that you find after the footnotes, those statements combine up to the front basic financial statements that we do opine on, and so we extend what we call an in relation to opinion on those statements, and so they're kind of included. And then as far as other information, that is your introductory and statistical information. We don't extend an opinion on that information either as well. We do look at all of the information and make sure that it doesn't contradict what we are opining on, because it's all in one document. All right, and then the last slide, we just kind of want to give you a heads up on any new financial reporting changes that have come out, new standards that are coming out and will be required to be implemented in the near future. The biggest one on here to me is GASB 101, that's the compensated absences. Currently, you have some compensated absences on your financial statements. That is the vacation time that your employees have earned and will ultimately be paid out in the future. But there's also sick time that your employees are accruing that currently is not recorded as a liability. Now, while a lot of that sick time ultimately gets used in your pension service credits for your employees, there is a portion of that sick time that actually does get taken and paid out in the payroll on a regular payroll basis. And so that's the amount that we're asking your finance team to come up with an estimate of how much time have those employees accrued as sick time that actually will be paid in cash in the future. And so Robin's going to get out a crystal ball and come up with that number and include that in your financial statements next year. So best of luck on that. The rest of these are not that complicated. They're not that big of an impact that I'll expect. 103 and 104 are actually for further out than next year, so we'll take a look at those and see how they impact it, but it should be very significant, so I won't go into any detail. All right, there is one bad thing about your results, and that is that the LGC has what they call financial performance indicators, and so they're looking at metrics of numbers that come out of your financial statements. And there is one that triggered this year that's new and different. It's related to your water and sewer district funds. Specifically, it's related to, we believe that the Norcrest district triggered this year. That fund had significant maintenance expenses that actually caused an operating loss, and so that triggered a financial performance indicator for the LGC. What they're looking for is a response from the board, just to kind of explain what's going on there, because currently right now the revenue coming in for the fiscal year 24 can cover the expenses, and so they don't want that to happen on a regular basis, and so they just need an explanation of what's going on there. So I believe Robin and Clarence will put together a response for you guys to submit to them within 60 days from today. So not a big deal, but something they need to get an understanding of. All right, that's all I have for you guys today. I'll be glad to take any questions or comments.
Thank you. We appreciate the update and all the work on this. I know it's a great deal of work, and we appreciate the level of effort, and great to hear the interaction with our staff as well. So I will open it up to any questions by commissioners. Commissioner Adams?
I just have a question, and this is just to Robin and to management. That's an enterprise fund, right? Which basically has to, I think it's just important for us to know that's an enterprise fund, just to be able to put that out there and have to be, it has to pay for itself.
Correct.
Okay. Thank you. Thank you.
Are there any other questions from the commissioners? Hearing none, I'd entertain a motion. Commissioner Fairclough, you want to make that motion?
I would move this time we accept the results of the audit as presented.
Second. There's been a motion and second to accept the audit as presented, or the recommendations from the audit as presented. All in favor, raise your right hand.
Commissioner Council?
All opposed, like sign.
Unanimous.
You see unanimous, Madam Clerk. We'll go ahead and move forward. Thank you very much. Go ahead.
On that, is that moving to the consent agenda, or is it going to be a presentation on, about whether she's coming back on Monday at the meeting to be able to do that?
We'll move it, we'll correct me if I'm wrong, County Manager, we'll move that so that it's a presentation so that we hear it, so that the public hears it, and it's not just on consent.
Correct.
Go ahead and move to item 2B, USI Health Insurance Plan Update.
Yes, we have, Chairman, we have Ed Boardman here from USI. He's going to provide a current overview of our current financial analysis regarding the health plan and the market analysis, and discuss a little bit about plan renewal. Brian, do you want to come up too? And Brian, kind of give us an overview also. And afterwards, we'll answer any questions that you may have.
Just use what you signed.
I just got this, and this one's not put in there, so I don't... Where's Danny? Where's he at?
Can we get somebody to get Commissioner Fairclough?
Give me the line.
I'm sure you'll sign when you're saying you use it in password. That's what it is. We'll get you hooked up. Give us 1 second. Can you see it?
Yeah, I'm okay.
Go ahead, Brian. Thank you. Thank you.
Good afternoon, Mr. Chairman, Commissioners. I'll be brief. I'm here to introduce Ed Boardman with USI, the county's benefits broker. During the annual benefits renewal process, USI typically presents to the board twice, once in February and again in March, as they work to put forward projections for the renewal year and solicit and implement feedback and direction from the Board of Commissioners. This year, to allow some additional time for discussion and feedback, as well as there are a number of action items that we're seeking feedback on, we brought USI in a little bit early in January for this initial presentation. The intent is for them to come back in February and March of this year, as is normally done. I do want to note just a couple of items related to this. We currently have an RFP out for our on-site employee clinic. The current contract is a 3-year contract. That runs out June 30th with the current provider, Proactive MD. That RFP process is being conducted by USI, so we'll be coming back to you with information related to that. And then also, Ed will be discussing something called the Employee Wellness Incentive Program. I want to make sure this is related specifically to discounts employees can earn on their premiums. We have a separate Employee Wellness Incentive Program through our Employee Wellness function, so those are different programs. And with that, I'll turn it over to Ed for the presentation. Thanks, Brian. Good afternoon, everybody, and good to see you all. Happy New Year.
Good afternoon.
Some new faces as well as some I've seen before. Good news today is you're not making any, as Brian said, any financial decisions. It's really just to give you a preview of what to expect in our next meeting, and then as you know, in March, where we set the final decision. So with that, I think April set the tone, so I'm going to have to be brief. And okay. So if you've had a chance, hopefully to read through, I'll go through some of the highlights again, executive summary, the current financial update, hit a little bit on market trends, what we're seeing as an industry, and also regarding employee benefits, and then, as Brian mentioned, some of the decision points that we'll need you to consider for our upcoming meetings, and then just the timeline. So if you had a chance, hopefully I'll be brief here. So the financials, you're running well this year. We're right now with 5 months of data, so again, it's not a full year yet, but at least the picture is you're running at under budget at 99%. As you look at the claims and total costs year over year, it's about 16% if we compare the same time last year. And that is really as a result of about 3 to 4% growth in headcount. So that's increased your total cost. But on a per employee basis, just running over 11% on employee costs for the medical and the pharmacy. From a clinical perspective, large claims are slightly down, which is good. We are seeing some of the same things, which again is not unique to the county. Cancer, heart, certainly, and diabetes with kidney disease as well. One of the things that I think everybody remembers last year, if you're in this meeting, we had an update on the GLP-1s and kind of the impact to your plan.
That still is trending at a high rate, so we're going to talk about a couple of the alternatives you have. Certainly, I think you're aware of what the state did. They eliminated the planned, coverage of weight loss drugs altogether. That pretty dramatic, but certainly is an option. There's also some utilization programs that are out there. Blue Cross is introducing a new program we'll touch briefly today, just to give you an idea what that's about, and then we can give you a good idea of what that involves. And then last piece, the pre-65, again, I know those folks are a smaller number on the plan, but still continue to drive a good portion of the overall cost. This is just a little bit of history, and again, I won't spend time here. I think you're running this year slightly above the 10.36, so it's not excessive as far as the first 5 months compared to the previous years. The dashboard, again, you've seen this, and we've presented this in the past, so through November, and this is again July through November, as you start at the top, you can see kind of 23 versus 24 side by side. The first piece is just the net claims, and that's what we mentioned in the executive summary. The piece that you want to point out is the gross pharmacy cost. So that number at 40% is certainly a high number, and we want to talk about, between the GLP-1s and some other things that we're doing. We are also, and I'm not sure if you mentioned, we're marketing the pharmacy, so we're looking at you have a current contract through Blue Cross, which is Prime. They use Prime Therapeutics for their pharmacy benefit manager. We also are looking at, with them, improving what they offer from a contract perspective, as well as for the rebates. I think you all might be familiar with those rebates on the back end. That certainly is not very clear, but certainly it's part of the cost equation. So we're looking to improve those terms, and then also look about carving out and what that could involve as it relates to cost savings based on your utilization. This just shows you again the year over year, and again, not much to take off this other than the first 5 months. You're running very similar, actually a little bit better than last year, when you look at August and a couple of the months in '23. From a chronic condition standpoint, this is really through our analytics system, we actually take your data and then we compare that to our book of business, and there's about 3 million members in that book that we look at, and you compare some of the chronic conditions. As you can see, they level set it per 1,000. So, as you see, hypertension, high cholesterol, and diabetes, those are also top drivers for a lot of customers. The thing that you just look at the prevalence, and that's the piece that I think we'll talk to in a few slides, where we have some ideas of things that might, and certainly want to address from a health standpoint, as far as making sure you engage those members and take better care so they don't become high-cost claimants. This next slide here gives you a good idea, and mentioned before about the drug cost, running at 40% of the overall gross cost. As you look at the left, and it's sort of the two sides, the left is, the dollars, and the right is the number of scripts. As you can see, Wegovy, Mounjaro, and Ozempic are the three top medications that are driving costs, and that really is certainly something we want to keep an eye on, and that's why we want to talk about some of the opportunities there that we can look at for trying to mitigate that. As you look at the overall, about 38% of your cost is driven by GLP-1s, so that's a high number. If you look at just the book of business in general, it's roughly about 15%, so that gives you an indication of, it's almost, 2.5 times higher than the norm. I'm not going to hit the trends, but certainly I think you go through these. Some of them relate to what we were just talking about on the drugs. Mental health is always, since COVID, the pandemic, we've dealt with that with a lot of employers, providing better access, making sure employees are getting access to providers, and then cancer, continues to be a high-cost driver for most clients. So Brian indicated the decision points to think about, and we want you to, today, no decision, just to understand. So when we look at the wellness program, this is the incentive Brian mentioned, so the discount on the payroll deductions, so that what they pay out of their paycheck for the health coverage. And as you look at the program, it's been the same program for a number of years, has not changed. The incentive amount for the criteria, you can see in the box on the right-hand side. And when we look at some of that criteria, some of you may be familiar with some of these things, but a BMI or glucose over almost 200 is definitely, your doctor would be concerned. And that's something when you look at some of the metrics, want to look at potentially a program that has a little bit more impact. And that's really where, on the next slide, I'll talk to you a little bit about it. But currently, if you're not aware, the program is a once-a-year health fair. And so the employees get their biometric screenings, get their health risk assessment, and go through it. If they meet metrics, they get the discount for the following plan year. A lot of times, the problem we find with that is that there's a lot of employers that do those type of programs. The challenge, though, is sometimes that data doesn't get back to the primary care doctor. And that's the person that's going to help drive their care and make sure they're adherent and look at all the gaps in care to make sure, they try to eliminate those things. And that's really why we're going to recommend a program that's kind of centered around a primary care doctor. And as far as the credit applies, so this year, the employees that have the opportunity, they have the wellness credit up until February, and then it resets every February, where if they meet this criteria, they get the $30 off per paycheck, and if they don't, they pay the additional amount. The proposed program is, and this, you may have seen this, some of you will be familiar with this, because the foundation is similar to last year. What we're offering, or what we feel like is a good strategy. USI actually uses this for our own employees, and it really is centered around the primary care physician. So what the requirements are, employees every year have to get their annual physical and then get their age-appropriate screenings. In addition, there's additional incentives to offer out so that wellness, whether it be getting your teeth cleaned, getting your vision checked. There are other things that we certainly would value, but this really kind of brings it back to making sure some of those people that aren't getting these things done today are compliant, which is hopefully detecting some of those high costs or chronic conditions that are going to develop down the road. So that really is kind of the broad overview. So what it would change is the health fair would say, you still have the annual health fair. The employees would still have the opportunity to learn about the benefits and promotions, but it would eliminate the biometric event at that one-day event. And that biometric event would go back, and that would either be done at the clinic, on the on-site clinic, or it would be done at the primary care physician. And so employees would still get that done as a part of their annual physical, but the difference is it's going to be with their physician, who's going to hopefully help them plan out based on their results, the best course of action for that individual member. The activities that would be required would be two, so you'd have to do the annual physical plus the either age-appropriate screening or one on that section number 2 on the list there. And then the proof would have to be submitted by the end of November in order to make it for the following year. So this would actually go into effect next February. So a year from this February is when the new premium incentives would go into effect. And we'll get into what that number is. A couple other considerations, one of the things that we would do for this program is there is a tracking component to it, so you want to make sure people that get the physicals and submit the proof are getting the actual incentive. So we do have a third party that helps do that, so there is a...
Did you touch it, or did it just go to sleep?
we have a third party that actually tracks that. And that would be something to help you really monitor and maintain the overall program. The incentive itself would be, what we're looking at is, and this is more based on what we see in our book of business, at $50 a month or $600 a year is typically best practice. You can go higher than that, but I think based on where you are today, $300, that would be a next step that wouldn't be a huge jump, and certainly would be an additional incentive for people to get their, the wellness screenings. Only outstanding questions on the program would be, we'd have to decide is, do we want to include, because we know when early retirees, they get the credit when they retire, and they don't have to meet any of the criteria going forward. Do we want to include them, or is there an opportunity? And the other piece is spouses. We know spouses drive healthcare costs, so that's something that could be a year, 2 or 3, so you don't have to actually do it all at once, but just something to think about for future consideration. This is, again, discounts today. When you look at the premiums the employees pay versus the wellness versus non-wellness for both plans. Okay. The other piece, the other decision point was related to the lifestyle program. We currently have a diabetes program today in place through Livongo. They're owned by Teladoc, which you may be familiar with, the digital healthcare provider. And really, it's only been in place for about a year and a half. And the program today deals with prediabetes, diabetes, and then also hypertension. And it's really a coaching program as well as monitoring program to help people maintain those conditions and hopefully prevent them from going from pre-diabetic to obviously having full-blown diabetes, and then all the other chronic illnesses with that. The program that, this is really Blue Cross Blue Shield, and a lot of the carriers have started to look at various ways that they can offer utilization management programs to help control the costs of GLP-1s. So you're not the only one. Certainly, and Blue Cross is rolling this out as a 1/125, a new program through Vita Health. Vita has been around for about 10 years. And they're really, it's a weight management and GLP-1 utilization control program. And they provide, there's some similarities to Livongo, and we would probably recommend that Livongo stay in place for diabetics, but the weight management and then the GLP-1 utilization control would go through Vita Health. In order for employees to get the medications to actually fill the weight loss GLP-1s, they would have to go through the Vita program. And they really have a kind of a pronged approach. So it certainly is through education. If someone's new to taking these drugs, they would go through the process with them to figure out whether it's one of the GLP-1s or is it a combination that they need to change their lifestyle or the diet. There's a lot of things that go into play, and certainly don't want to focus on just the medication, but ultimately what they do is if someone does need a GLP-1, then they would recommend it. And again, it's based on the criteria that they set forth that are really a best practice for what we see with most patients. And it's going through those steps in order to get to that point where they actually get the drug versus filling the medication. And for those of you who are familiar with it, a lot of the times because of the adverse reactions that people have with these drugs, they stop taking them. And there's a big expense, and some of that could have been avoided potentially if they'd gone through the steps earlier to talk to a coach, figure out if it's the right solution for them, or maybe there's another medication that would help potentially control what their condition is without actually the cost impact that the GLP-1s are driving in the plan. So that's a little bit on the program. The one thing I want to point out is in order to control the kind of the flow and the scripts of the GLP-1s, that would be the one one main condition. They actually have to run through VITA. You can pick the program just for weight management, but if you want to put that in for GLP-1 management, they would actually control the network. So when an employee gets a medication filled, they would prescribe it and they would have that kind of control versus it going to either the in-house pharmacy or another retail pharmacy. So that's something I just want to make sure you're aware of. I mentioned some of the, the things we're working on, the future considerations, some of the other projects that we have planned for after this plan year. But I think in view of the time, I want to just I'll end it there and open up to any questions.
Thank you for the information. I'll open it up to, Brian, do you have anything before we move to questions? I'll open it up to commissioners for any questions. Mr. Fairclough.
Thank you, Mr. Chairman. If you refer back to the chart that looks like this, top chronic conditions, can you turn back to that one real quick?
Sure.
Last year, we went out on a huge limb and started covering the GLP-1 drugs, okay, as you may recall. And I know we're not making any final decisions today, but we're taking a gamble. And if you look at that chart there, the big blue lines, that's us, that's our group. And the rust-colored line, I suppose it is, or gold, whatever that is, that's everybody else that you have. Those 3 million people or whatever you said. And we're way out of line on those metrics for hypertension, hyperlipidemia, and diabetes. Okay, and we gambled that these GLP-1 drugs over time will bring back in line some of the metrics for these particular items here. That's not going to happen this year or next year, but over time, we believe, and at least the anecdotal evidence that I'm seeing out there is they're working. And they've got some other heart-related benefits, other benefits to them as well. And if I'm seeing this correctly, we're not over budget. And I think in our minds, we're prepared to be over budget because of the cost of those drugs. But it sounds like we're hanging in there so far this year. Am I correct in that?
You're correct, yeah.
Yeah, that's correct.
Okay, so that's, so far so good, right? Because that's a decision we took a hard gamble on last year, Mr. Chairman. Thank you.
Yeah, no, that's a good point. I think the one thing that, and it's still too early, as you mentioned, so I think from a overall, whether it's heart and some of the other conditions that they've been, the studies have started to show that they're going to help with as well. We haven't seen that yet in the claim costs, and it's not unique to the county. That is going to take time for everybody, so I think it's, our recommendation certainly wouldn't be to go to the Jurassic, which the state did, which is eliminate the program, because I think you're right, you made the decision to cover them, but some of the utilization management programs would not be certainly taken away. It would just be stronger criteria around the folks that are taking them, that they're using them properly, and the ones, that obviously have opportunity to still have success, whether it's through some other type of coaching, can get that help rather than just going straight to the medication. So again, it's an option. I know last year we had also put on some recommendation, maybe we just cover them through the retail, so there's a little bit more of a cost share. And we decided to keep it through both the in-house pharmacy and the retail. That's still certainly an option too. I know that the majority of the medication that is being filled, probably about 85%, is through the in-house pharmacy. But again, we'll come back with additional opportunities, but we definitely wanted to present this knowing that it's just to be mindful of what the cost impact is.
Commissioners, any other questions? Commissioner Tyson?
Thank you, Mr. Chairman. One question I had with the current provider that we're using with the Livongo versus your recommended provider with the VITA, is there a measurable, significant difference in the cost to administer those programs between the two?
Yeah, good question. And because of what they do, because Livongo doesn't offer the weight management GLP-1, they do weight management, but it's not related to the GLP-1 utilization control, so that's why we recommend side by side, at least initially. The cost for and it does vary if you have a pre-diabetic, a diabetic, or a hypertensive engaged member. So they don't charge a admin fee just by enrolling. You actually have to participate in the program and actively engage, and then they would bill. And it comes through the claim account. It's $55 for the Livongo program on average. And then it'll be slightly higher or slightly lower depending on if you're just pre-diabetic or if you're high blood pressure. And then the cost for the Vita program is $145 per engaged member per month. And what we asked Vita, because when you look at the population, Vita did an ROI study just to show what that modeling might look like based on what they would expect to enroll. And at 10% of your membership enrolling, it's about $230,000 a year from an administrative fee. But their other side to that, from a cost avoidance to health improvement and all the other things that would happen, they had about a 2-to-1 kind of ROI. So the investment would be the $230,000, but the savings would be around $500,000, approximately.
Thank you, Mr. Chairman. Anything else? Commissioners, any other questions? Commissioner Adams?
So, some of this could possibly be legal. We got 71 more employees in this than we had last year, right? Yeah. Okay. And so some of that could be driven by the increased number of employees, and as we get more employees, that's going to happen, right? Yeah. And I guess the second question, which goes along with that, if we go to the Vita, is it still going to be filled by the pharmacy, or is there a cost that the employees are going to have to pay for the drug? Is it an increased cost also on the drug?
No, there wouldn't be any change in so whatever the drug class, whatever tier it fell under, they pay that copay. The difference would be they would be managing it, so they're not actually filling it, but they're...
It's going to be filled by the pharmacy is what I guess.
Right.
And the rate that is whatever it is now, or would it be higher? That's what I'm trying to figure out.
So from a cost, it would be based on, it would still be the same as what it currently is. The only difference is they're controlling who gets it. And the scripts that they write are coming directly from Vita versus my general practitioner.
It would be probably more managed, and the cost would probably go down lower. The prescriptions would probably go down, so since they're actually managing the weight management program.
So, and I guess my other question would be, so the doctor prescribes this, and they're going to you have to go through this beforehand? I mean, I'm trying to figure out if the doctor says, hey, I'm prescribing this because you need this, is this where they got to go, and then they make a decision based upon whatever factors they get as to whether you can get this drug or not?
And again, I'll get some clarification, I'll get more details, because this is just high level, but my understanding is that they control the prescription, so it's not something where your doctor could just override that. The plan would reject it if an employee took that script to try to get it filled versus, going through the Vita program.
So I'm at my doctor's office and tell me I'm 50 pounds overweight. Let me stop. All those obesity charts, they put me on the obesity charts, but I'm not. But anyway, so your doctor looks at it, looks at your pre-diabetic, looks at your diabetic and says, hey, you need to have this, I think this drug is going to help you. Then these people I'm trying to figure out whether they can override the doctor, is what I'm trying to figure out. Because that doesn't make sense to me if my doctor's doing that.
We'll bring you back, but if you had that situation, and correct me if I'm wrong, you wouldn't have an issue going to your doctor. But if you enrolled in this program prior to going to your doctor, that's when they manage it, and they would deny if you went after you enrolled in this program to your doctor. So say if I enrolled in this program and then they're managing my prescription. And then I decide, well, I don't like what they did. I go to my doctor and try to get a prescription. Then you would be denied because you're already enrolled in this program.
So then my next question would be, everybody that's already there wouldn't go into that program. I wouldn't, because my doctor's already got it. So it's just new people who do that. That's, I guess.
We have to bring that decision point back to you, but that's one of the things we would want you to decide moving forward.
Yeah, and so I guess, Mr. Chairman, the next one, go ahead and follow up. I'm just trying to figure it out. So, is it going to be mandatory that everybody has to go into this program? I know that if you got the diabetes, I guess if you got diabetes and whatever, you don't have to go. I'm just trying to figure out. So these are questions if you can bring them back to her, because I'm not understanding quite where we are with this program, and actually what this program, I guess, I enroll in the program, I give them all my, or do they do a health screening of me?
Yes, they do.
Okay.
So today, the program works, the doctor, you go to your doctor, and they're going to say, okay, based on your weight, we think this drug will work. And as far as, yes, this member has been exercising and eating, so we think this is the best recommendation. And that gets filled through the current benefit. This would replace it. So the program would become the gatekeeper. So they're actually controlling who's getting the medication and who's not. So going through and, so it's more than just saying, yes, raise your right hand, do you swear, this is true. It's actually the results that, yes, they've been participating in the coaching program, the food, eating right, as well as exercise, all that is actually taking place. And now, based on BMI, yes, they've done everything else, and they need to, need these medications. So this, again, is not to say this is the only option, but it's if you want to get control of the continued increase in the cost, which, again, you could also just decide to say, let's give it another year. But again, we promised after last year's meeting that we'd keep you apprised of kind of where we are with the, these drugs in particular.
So I guess Mr. Chairman,
I think the county manager had a comment.
We'll bring it back when we bring the overall recommendation, and we'll have it fleshed out a little bit more for you.
But Mr. Chairman, can I submit questions? I'll just submit questions to staff. Maybe we can get some answers, just some of them. So that we on this. I
think they're going to bring this back to us at a future meeting, so if any of the commissioners have additional questions, because that's a good series of questions, and this is a big cost, so we need to definitely look at it. Commissioners have questions, we can phone those into the county manager, so when we come back, unless there's something pertinent from the presentation today that we want to answer, not specifically, but good line of questions, Commissioner Adams. Commissioner Tyson, do you have something you just want to throw in?
I'm good, I'll follow up.
Vice Chairman Joe.
Thank you, Mr. Chairman. I did have one question. I just want to make sure I'm understanding correctly. It can be any one of those that are in that listing that would allow you to be able to be in their particular weight loss program? What I'm trying to say is this. I want to make sure I'm understanding the option. If you choose to go in their weight loss program that's offering this, you don't necessarily have to have diabetes. You can have any one of those listed.
So the criteria for VITA is actually, it's under a BMI of 30 down to 27 with a comorbidity, another condition that's causing you to be driving your health. Or if it's over a BMI of over 30 would be the criteria to participate in VITA Health. Yeah, can I contest that? Those are from a VITA perspective, in order to participate in the utilization program, those are the criteria.
Well, that would be a good option, because one issue that I do know that's happening with the Wegovy drug is that if you don't have diabetes, I guess that would be a good option, like you said on here, is that if you don't have diabetes, a lot of insurance companies are denying that. So where, I guess that would be a benefit. In this program, like you stated, if they're focusing more on your BMI, meaning if you have a condition without the diabetes, possibility they can give you that drug. So
That's a good option.
This
weight management specific, not just the diabetes part of it.
Exactly. because I can tell you that's what's happening with that particular drug. Thank you. And that's it.
Commissioner Fairclough?
Just very quick follow-up, Mr. Chairman, thank you. When I said we took a huge gamble, we did that on behalf of our employees, because we, as you see from the chart doesn't lie, our employees can benefit from weight management and that sort of thing, okay? And we knew it could cost a good bit, and we asked for any kind of management ideas we could do. So this is what we asked for. It may be a little more than we asked for, but certainly we did ask for this. So it's not by chance that this is here, and we will have to evaluate it. But we are self-insured. The taxpayers pick up the tab for any overages here, other than what we can budget. So we want to keep it within budget, but when I said we took a gamble, we did. Nobody else is doing this that I know of, but we went out on behalf of our employees, because our employees, we think, need it. We're not doctors, but we can see things. And so we're very interested in how this comes out. So in February and March, when we talk about this again, I hope all these questions can get answered. And read this in thoroughly. Any other questions that come up, let's get them answered and have them here in March. Thank you, Mr. Chairman.
Thank you, Commissioner Fairclough. And again, just want to reiterate, if you have questions specific to this, let's make sure we get them in a timely manner to county manager. Two quick questions from my standpoint before we move on. One, on the PBM side, who's doing that review, and what is it is there gonna be an outcome to say that?
Yes.
Because I know there's lawsuits and settlements happening in other states and other counties where we're getting access to those rebates, and that's a direct bottom line impact for the county.
Yeah, and those rebates have, over the last 3 years since you elected to go and participate, because prior to that, the county was not actually receiving those, Blue Cross was keeping them. And so that's what we're reviewing, and so we'll come back with once we have the results, all the various PBMs, including Blue Cross. We're asking Blue Cross to say, you really want to see your best shot so that you can keep the business, but obviously they have to, make sure the terms and the pricing is appropriate based on what's in the market. So we'll have that, should have it for next meeting, preliminary to review, and then certainly, I know you're not going to be able to make a decision, but at least to see the results, to see what that looks like.
Just want to make sure we see that in the next feedback to us. Thank you. And the last question is for Brian, the RFP for the Wellness Center. If you could just circulate a copy of that. I know, based on some earlier conversations, that probably be something good for us to take a look at.
Okay, absolutely.
I think that's, unless anybody has anything else, there's no action needed, so we'll go ahead, County Manager, no action needed, correct? We'll go ahead and move forward, thank you.
Thanks, everybody.
Thank you, guys.
We'll go ahead and move forward to the Fayetteville Cumberland Parks and Recreation indirect costs briefing by Michael Gibson, Parks and Recreation Director. County Manager, I'll let you set it up. Cumberland County, Fayetteville, Parks and Rec.
Yes,
Are you breaking the chair? Go ahead, County.
Yeah, during the October 14th City Council meeting, it was requested by City Council, Fayetteville City Council, and Michael Gibson provide us a presentation regarding indirect costs for the Parks and Rec, the combined Parks and Rec program. And turn over to Michael.
Thank you, Commissioners and Chairman. Appreciate y'all letting us come and do this. Also brought along my supervisor, Adam Lindsay, Accounts Manager, Amanda Mott, and Jessica Leggett, who's my Business Manager, Assistant Director for Parks and Recreation.
Real quick before you move on, can we either make that bigger or we get a copy of it? Get a copy of it so we can look at it.
Thank you very much.
So everybody's glasses going.
Appreciate that. See.
I don't even know if that's big enough.
Okay.
Thank you.
All right.
Just to give a little bit of history.
Not much better. Not much better.
It didn't get no bigger? Oh, okay. All right. Just to give a little bit of history of how we got to this combined environment with Parks and Recreation. Back in 2001, consolidation the conversation started back in 2002. There was a council that accepted resolutions from the county commissioners and the council. And then you can see there was a liaison committee. Then back in March 2003, resolution was adopted. Council endorsed the proposal amendment. And then in 2004, it was voted upon, and then in July 1, it started. You can see since 2004, the initial groups that were in the district were Godwin, Linden, Falcon, Eastover. Since then, we've included Linden and Spring Lake. Since then, 2004, there were 2 rec centers built, one in Eastover Central and then one over at E.E. Miller Rec Center. During the annexation era, the city annexed in Lake Rim. Also, we took over a lease that the county had on Lake Rim back in '95 for about 40 years. And then the city passed a bond referendum that now has 2 senior centers that are open and running, a skate park, and the last 2 items, the tennis center and the sports complex. We're working out some logistics on that to get those things done also. Since then, we've opened up 3 outdoor aquatic centers. Just want to emphasize outdoor there. Then the county removed J.P. Rill, which was in the original district at one point. There's just a little map and the little pinups of how the recreation system is dotted out through the county and the city. There is access, and if anybody wanted to know how we do our service areas throughout the county, if you're in the district, we try to make sure that there's a 3-mile radius for people to be able to enter into a rec center, and if you're in the urban environment, it's 1.5 miles. Here's a funding model that we use and how we run the operations. You can see over on the city side, we have all recreation centers are budgeted. The splash pads, we have had an explosion of splash pads over the last 5 to 6 years, which are heavily used, let me tell you. The aquatic centers are 50%. The senior centers, and what that means is anything that's a county-wide program, like the pools or the senior centers, the adaptive recreation, special needs, all of those are shared responsibilities within the recreation departments. The right-of-way service is something that the city takes on. Cemeteries is another thing the city takes on, and we do our leaf season throughout the city. And that budget includes also City Hall. And then on the city side, there's 130 positions. And then on the district side, all the recreation centers out there, the 6 splash pads, and then the neighborhood rec centers, and then the aquatic center, and then the $60,000 that's paid into since 2004 for the indirect costs, and then the number of full-time FTEs for the district. And then you can see the funding for shared facilities, and what that means is the senior centers, Gilmore, where the special needs are at, and then the employees that are shared and mainly administration. The definitions of direct and indirect, it's here, and it's the cost for personnel. From the direct standpoint would be supplies and equipment. The indirect costs are shared administration expenses that are incurred. The indirect costs are applied across the city to get the reimbursements and the government's general acceptance of accounting principles and best practices. Always based on the audit actuals, not budget. And then you had what we were having conversations about for the last year and a half, or probably a year and a half, is what that amended agreement would be, and it's in the adopted agreement, is that the county shall pay, and this was the original back in 2004, would pay the $60,000 for indirect administrative costs, and that, it's been 20 years. And then the county, the amended would be the county shall pay an indirect cost related to Parks and Recreation in the district, and that would be determined by a cost allocation plan, and that's what we've been negotiating, been talking about, working on, trying to get to a good place. And then this last slide is just an update of what the conversations have been, how long we've been doing things, and we won't go over every one of these, but if you look at the second to the last one in September, the company that we use Maximus, and from what I understand, that's a basic practice, and they prepared a cost allocation plan where we believe that number is about $580,000. And then the county staff indicated a review of the allocation plan, which there have been conversations going on, and you can see it back in October 8th. So I appreciate this and getting this to you, making sure that everybody understands where we are and how we're trying to make sure that this relationship even gets better. Is there any questions?
Thank you, Mr. Gibson. You're probably going to have a series of questions.
I'm sure I will.
I'll go ahead and open it up. Vice Chairwoman Jones.
Thank you, Mr. Chairman. In reference to the funding, and thank you for your presentation, I have a few questions, like if you flip back to the funding, as it states here, I noticed the percentages like 50% of Aqua Center operating budgets, 50% of Senior Center operating budgets, but I don't know what those, it would be helpful to me if I knew exactly, when you say 50%, I don't know what the Senior Center operating budget is, if I would know what those specifics were, and then also, not just in reference to that, but for instance, all City Recreation Center operating budgets. So having a specific number to know what those particular budgets are in each area, I know for me personally would be very beneficial for me to be able, a quantitative say how much percentage I feel like we should be, being able to be responsible for.
I think the county manager has requested those, and those have been sent over, so I'm sure that they'll be disseminated out to all the commissioners.
Oh, okay, thank you.
Other questions from other commissioners? Commissioner Patel, go ahead. For a series of questions.
I'll try and hold back. So, thank you, Mr. Gibson. For the $580,000 for the indirect costs, it looks like it was $60,000. The company that you said you use, Maximus, what exactly was the background on how they came up with that $580K, and what does that go into?
Amanda Mott is here to help me with that. There is and I've seen it. And what they do is it's all the services, all the costs that it takes, all the entities from IT to the webpage to the manager's office, everything that the city has to do, they take all of that into consideration and they cost share across the board. But Amanda's here.
So Maximus evaluates all of the support services. So as he said, any of those departments, including finance, the city manager's office, IT, go into the plans. They look at the total cost of running those support services. And there's a variety of methods that they use to allocate those costs out. Some look at the usage, so the number of transactions that happen within each of those areas. Other look at FTE, the percentage of full-time equivalent for each of those areas, and they come up with a calculation. They call it a two-tiered calculation to disseminate the costs across the departments.
Can you give us a little bit more of a breakdown of what that 580 is spent on? I mean, I understand the aggregate, what you're saying, but...
I do believe that we provided the plan to the county, and we can do that again, so that you can see the details of the breakdown.
But just to give an example, the cost to manage the IT department, each one of the FTEs, there's a calculation and you multiply that number. And then that gives you a cost of what it takes for that particular individual, that FTE, to use, or IT to pay that person, or for them to have a computer to check their emails. It's just the cost of doing business. And that's how they use that calculation.
Commissioner, or Vice Chairman Jones.
Thank you, Mr. Chairman, and also, my question is pretty much in piggyback to Commissioner Patel. Again, as I stated prior, and I'm glad if you sent the information, if you all could send it again, because the breakdown of exactly where money's going and how, and then how it's being distributed, it personally makes it easier for me to equally be able to see what's what, so we really would appreciate it. I guess all that's going to our manager. Am I hearing that correct?
Yes, ma'am, you are.
Okay, thank you.
Commissioner Tyson.
Thank you, Mr. Chairman. Did the Maximus calculation take into account any indirect cost or any lost services that the county would have incurred as a credit back towards that cost? For example, we own the facility over on, the county owns the facility over on Highway 24. So the Parks and Rec Department uses that facility. We're not charging anybody to use that facility. Are we getting a credit back for the fact that we own that facility?
What facility are you talking about?
The one on Highway 24? Parks and Rec facility there?
Are you talking about Stedman Rec Center?
No, the actual...
Highway 24?
Yes, sir. Right there near Eastern Boulevard.
What's the name of it?
It's where it's like an office facility that's there that the county owns.
And the city uses it?
To my knowledge, that's the case, yes, sir. Mr. Manager may be able to expand upon
It's
this.
right there, and it's not too far off from the landfill. I'll get you the address and send it to you.
Yeah, because I don't know which one you're talking about, because what your funding pays for is your recreational service, and that's all your recreations from Godwin, Eastover, Clinton, Wade, Godwin, Falcon, those. So I'm not sure if there's another facility that the city, that you have, that the city uses, if you get any reimbursement on that, because I don't think there's...
I'll get you the address.
Are you talking about across from Food Line? Right across from Food Line, right there, right where the light is, right
Oh!
where... Yeah, that's where he's talking about.
That's not even in the district. That's not part of the recreational service. They're saying, you're talking about your maintenance department.
Yes.
No, sir, they're not in it. They're not in the system. They're separate. Yeah, okay, that's why I didn't know that. They're not in it.
Commissioner Tyson, anything else?
Yeah, a follow-up to that. So the $4,635,000+ that the county spends, that gives to the city to administer the Parks and Rec program, do you have a breakdown of where that money is spent in the unincorporated areas of the county?
Oh, yeah. That's the document that we sent over. It's itemized how much capital has been spent, how much it takes to operate the rec centers and run the programs, because that's where that funding goes.
Gotcha. Oh, yeah. Let's clarify that real quick. Mr. Gibson, County Manager, you want to clarify?
I think he wants a breakdown by individual district. So by Stedman, by Linden, by Eastover, the expenses for each one of those locations that we have in the district.
We can do that. All of them have their own account codes. From the staffing to the building to what we spent in capital at those places. The equipment that we use, everything still has its own account codes. So we can get that, we can get those numbers.
Thank you.
Oh, yeah.
Commissioners, other questions?
Just a quick question. Okay, this is for presentation purposes only. What do you propose that we do with it? Do we need advice from the county manager as to some opinion or something on this indirect plan here, so first off, and then second off, where are we going to send it? We're going to send it to one of these committees we developed, or something to look at it, or what?
Commissioner Fairclough, that would be the intent. This is for information, allow us to come back in and ask additional questions. My intent would be to entertain a motion to send it to a finance committee where we can take a deeper dive into it and actually get into some of the weeds on these allocations, how Maximus is set up, that level of detail. This is for presentation, so the board was aware that this is an outstanding issue between the county and the city, and the difference in the dollar amount, where our staff has some questions around the actual indirect cost and what we would pay. So my intent would be to send it to Finance Committee where we can get into deeper questions. Anybody have anything else before I ask a couple questions? Commissioner Jones? I'm sorry, Commissioner Fairclough, did I answer your question? Commissioner Jones?
Yes, thank you, Mr. Chairman. This is actually just a statement. I appreciate the transparency because I'm definitely being out in the community. I love community engagement, as many of us here do, and these are some concerns that I hear all the time from parents and other individuals that are involved with the Recreation Center. So again, just you coming here, I want to thank you. I want to thank the chairman and also the other board members, because transparency, and for those that are listening, and certainly being able to serve our community, I know that a lot of these questions, not just that we have interest in them, but these are things I hear from those that are actively involved and their children from the Recreation Center that do keep up with their government. So thank you so much.
Thank you. And anytime now, get that, because anytime you need some information,
transparency is important.
Call me.
So, Mr. Gibson, a couple things. One, we'll probably, and I'll let the county manager coordinate that, but as we have this finance meeting, we'll probably, as it moves to a committee, we'll probably want you and probably a level of detail from the finance side, from the Maximus side, to be able, so we can get some detailed questions answered at that meeting. We'll try to move those forward ahead of that committee meeting, but I'll leave that up to the committee chair. The other question, just as, and it really could be asked in the finance committee, but just for general understanding, the factors that are weighted, so when you're weighting these indirect costs, that's, it's one person's, their interpretation of what those indirect costs are. So those factors are manual factors that are laid in there, correct?
Yes, they are.
Okay, so when I get 47% of the indirect costs that are IT, that could be weighted in a certain way.
Yes, sir, it could.
Okay. And then the next question I would have is, as we look at Cumberland County and Fayetteville Parks and Rec as a whole, some of these operating costs, and I served on city council when we did some of this, but we stood up a brand-new senior center, and we brought on a lot of amenities that the county is now bearing 50% of the indirect cost on.
Yes.
But didn't have any direction on input on those initial operating costs. And the other question I would say is, what's the percentage of the county population using those versus the city population using those?
Well, we don't ask any questions, and previous commissions have just identified what a countywide program is. So we don't, if you go to a senior center, we don't have somebody at the door saying, if you're in the county, we need to dock you, we need to understand this, so we put a check mark. We just say that that's a countywide program, and seniors from all over the county can come in it. The same thing with special needs children. We don't identify, if you walk through the door and you're special needs, okay, we need to make sure that you're from the county so we can say what percentage you are in this facility. We've never done that.
I fully understand that. So how do you get at 50% then?
Because it's the operation and it's a countywide program.
Again, that's that's another factor that somebody made a decision at some point, and
Yes.
may or may not have been an elected body, that was brought back to say, this is how we're going to allocate cost. The process we're going through now is how we're going to allocate all these costs. So that, some of these are still going to be up for discussion.
Exactly.
Okay. I just want to make sure we're setting the conditions for what we're talking about. We're moving from a $60,000 agreement
Yes.
that's been in place for years.
Yes.
To a recommendation that came from the city staff, or excuse me, from your staff, that about $580-something thousand, or $500,000+, and now we're going to move to say, okay, what can we all agree on is going to be the indirect cost as we move forward, and that's an accurate statement?
Well, and one of the things I want to make sure too now, when you talk about the equation, the county's portfolio has grown. From what you started out in 2004 to what you have now, the value of your portfolio has grown. When it was what it was, you didn't have the capital improvements that you had in your parks that you have now. That takes more staffing or more man-hours to manage. So you didn't stay where you were. You grew as an organization. You grew as a recreational department. So you have better stuff. So it takes more to manage your pickleball courts, your shelters, to maintain those. Just in the town of Linden, the town of Wade, over the last 20 years, the park system has grown by 30 acres in both areas. We've gotten grants from each one of those places so that we could purchase that land and make those. So there is a cost that the district has, and which is a good thing. It's the same thing we're doing in Spring Lake now. We're improving the system that they have there from where they started to where we're going to take them, because wherever you go at in the county, the recreational system should look the same. May not be as many parks, but the park should look the same. So it takes some effort to make that happen, so your portfolio has grown.
Correct, and again, we'll let the committee get in the further weeds on this. I guess the point that I'm trying to make is there's been decisions made along the way.
Yes, there has.
That not by this board?
No, sir.
Correct. That has allocated, that what we're seeing now has increased our indirect costs when we have
Yes.
not had input in those operational costs or inputs in the project.
No, to a certain degree.
To a certain degree.
Yes.
But I will say that it's been subjective on how we're looking at the indirect costs right now.
Could be.
If you have a manual input, Mr. Gibson, it's subjective.
I understand.
Okay. I will, Commissioner Adams, do you have anything else?
I do have just a couple of questions, Mr. Chairman. I think one of the things is, all of this predates us, there should have been an MOU. I've never seen it.
Thank you.
And so I would like to see, and if there's an MOU, it should either been amended down the road by somebody. You just can't just change that. That's not you. That's just whatever that MOU was. So I think one of the very first things that this body needs to do, because like I said, it predates everybody here, even you. But I think the first is to get the MOU and see what we've done and whether there's been any amendments to the MOU. The second question, and I won't go with this, but just listening to the question that you asked, Mr. Chairman, and then listening to Mr. Gibson's, is we got to get a handle on, because he talks about our parks being so much better, but that's a direct cost, that's not an indirect cost. So when you're talking about that doesn't go into the indirect cost. You saying we got better pickleball, that's a direct cost that you can just do. And so I think when the committee looks at it, is we've got to go back to these definitions of what that direct cost and that indirect cost was, because that was not an indirect cost. That was a direct cost of more pickleball, more basketball, more splash pads. The indirect cost is that administrative cost, which is that I can input whatever number I want to into that indirect cost. It costs me this much to be able to log onto my computer or do whatever. So thank you, Mr. Chairman, but I just wanted to make that
Mr.
point.
Adams, I think we're saying very similar things.
Yeah, if we can get that MOU.
Any other questions? County Manager, any comments before we entertain a motion?
No, we'll flesh it out through the Finance Committee.
Commissioner Patel? Go ahead.
I'd like to make a motion to move this to the Finance Committee.
Second.
There's been a motion on the floor, and second, I'll open it for if there's any discussion.
When you send those documents, if we can all get them, it'll go to the Finance Committee, but we may have questions that we want to send to the Finance Committee based upon, if we're not on that committee, like just what he was just talking about. So if everybody can get all of those documents, that would be...
And just as a point of clarification, we will begin as a body to use committees that have been stood up, and we'll use those as ways that we can come back to this board with recommendation at all times. All the commissioners will have all the information that goes to that committee. They can still attend that committee if they need to. But I would also encourage the commissioners, if they have questions, filter that into either the county manager or as well as to the committee chair, so we can make sure that those questions are deep dived into the committee meetings, so that the action out of the committee meeting is the best recommendation back to this board. So any other questions or comments on the motion on the floor? So the motion on the floor is to move the action of the indirect cost language that was presented to us, move it to Finance Committee for further review and a recommendation back to the board. All in favor?
And instead of just the indirect cost, the whole thing.
Yes,
I mean,
correct,
and not
correct.
just the indirect cost, but the whole issue, because it could be direct, indirect, so the whole, yeah, I'm sorry.
No, it's okay. Not just indirect
Right.
cost, but look at the cost, the cost between the Parks and Rec, the Parks and Rec commitment to not only the indirect cost that is being looked at, but also the overall capture of any of the direct costs and indirect costs. Does that clarify? You okay with that? All right, I'll go ahead and ask for your vote. All in favor, raise your hand, right hand.
Commissioner Council? It's unanimous.
All opposed, like sign. Madam Clerk, I believe that's unanimous.
Thank you all now.
Thank you.
Thank you.
Thank you, Mr. Gibson. Okay, we'll go ahead and move to item 2D, County Historic Architectural Survey.
Yes, Mr. Chairman, in November 2021, we were awarded $90,000 to conduct the architectural survey of sites in the county and resources. Ross Howard will present this item and introduce some of the presenters and people that worked on this item and in the presentation, and answer any questions you may have as follow-up.
Good afternoon, Commissioners.
Good afternoon.
I'm very happy and excited to be presenting a project that we've been working on for a couple of years now. This is an update to the Cumberland County Architectural Survey. Not meaning to steal the thunder of some of the staff that I have here, but I have Mr. Trey Smith, who is our Comprehensive Planning Manager, and I have Ms. Carolyn Gimbel, who is with JMT. She's an architectural historian that's been leading the charge on this. I didn't feel right to sit up here and present this since they've been working on this for 2 years, so I'm going to let them do the presenting. So we'll just hit into the presentation here, but I just want to say this is just for presentation only, so we're not asking for any action unless the board seems that it deems fit to do so. So without further ado, I'll go ahead and pass it to Mr. Trey Smith.
Thank you, Ross. Good afternoon. Again,
Good afternoon.
As Ross mentioned, my name is Trey Smith. I'm the Planning Manager for the Comprehensive Planning Section of the Planning and Inspections Department. Probably around 2020, my staff and I, we applied for a reimbursement grant, as the county manager mentioned, $90,000 for a architectural survey. We had been made aware that there was one done previously in the 70s, and that since that time, the funds available were federal funds from the Hurricane Michael and grant program, and we were made aware of those funds, and we applied for the grant. It was received in November 2021, and we came up with JMT Consulting to do the architectural survey update of the one that was done in the 70s. Carolyn Gimbel, she's an architectural historian with JMT. began the work and completed the work for JMT, and I don't have anything else really. If she has a presentation, a brief presentation of a summary of the results, and I'd like to turn it over to her at this time, if that's okay with y'all.
Please move forward.
Thank you.
Great. Gotcha. All right, good afternoon, everybody. I'm Carolyn Gimble, and I'm an architectural historian. Thank you for having me here today.
Can you pull that mic down? Yeah, there you go.
Can you hear me?
Yeah, that's better.
Great.
Thank you.
So before we get into the results of this architectural survey, I'd like to first explain exactly what that is and our methods and the study area that we covered in the county. So an architectural survey is a combination of fieldwork and research. The fieldwork component involves photographing buildings and structures that are 50 years and older, and we conduct research on these properties through things like the United States Census, deeds, newspapers, and other historical sources, including oral history interviews with current owners or previous owners, to aid us in figuring out who may have lived there, what the property was used for, and the importance of the property. Data from surveys like these are kept at the North Carolina Historic Preservation Office in Raleigh, and countywide surveys can help give us a broad sense of the important historic milestones that took place in a county and what in the built environment remains from those eras. So this survey covered the entire jurisdiction of the planning department, which is everywhere except for Fayetteville, Hope Mills, and Fort Liberty. So everywhere but that red hatched area on the map. So that means I surveyed in Spring Lake, Falcon, Linden, Eastover, Wade, Stedman, and Godwin, but also some unincorporated places such as Peters Creek, Beaver Creek, Slocum, Vander, Grays Creek, and Cumberland. So as Trey mentioned, the last time a survey of the scale took place was in the mid-1970s. So for our industry, that's within our historic period. 1975 was 50 years ago at this point. So phase one of this survey was a resurvey of everything that had been surveyed in some capacity before in the county, not just from that 1970 survey, but also from environmental review, things like when the DOT improves a road, they need to account for historic resources. So for phase one, we completed that in the spring and summer of 2023 and revisited 326 properties in order to check the status on each property. The main goal being to determine what may have changed about the property, including if it may have been demolished, and if anything about the status of that property could be attributed to Hurricane Florence. Simultaneously, we were able to drive the majority of the county and note properties that we could potentially survey in phase two. And during that process, we noted that a lot of the previously surveyed properties covered a lot of unincorporated Cumberland County well, but not so much these smaller municipalities. So the results of phase one, of the 326 properties surveyed, we found that 128 of them had since been demolished, so that was about 40%. Most of this wasn't attributed specifically to the hurricane, but most commonly related to just regular deterioration or development pressure. Other observations that informed our choice of properties for phase two was that we noticed a lot of historic farms and farm outbuildings were being reduced due to lessening presence of agriculture as a profession in the county. And that overall, among the phase one properties, there was a bigger emphasis on things from the 1800s in Cumberland County, which is really just a product of the time when most of these were first surveyed. Prior to phase two, there was a big knowledge gap in historic buildings constructed in the mid-20th century in Cumberland County, which was a very important time for the county due to the growth and prominence of Fort Liberty and how that kind of had a ripple effect on development throughout the county and increasing in population, things like that. So all of these were summarized in a phase one report, which is published on the State Historic Preservation Office's website, and also the Planning Office has a copy of it. So phase two took place in the spring of 2024 and involved the survey of 251 newly surveyed properties. So prior to field survey, we sent letters to property owners for those places that we identified in phase 1 that could be potentially good to survey, to give them an opportunity to consent to having their property documented more thoroughly. Unless we had explicit owner permission to enter property, we did most of our photography from public rights-of-way as to not trespass. And we were able to coordinate a lot of survey with specific kind of groups and stakeholders, including the Pentecostal Holiness Church based out of Falcon, and also the Cumberland County School District. So the Phase 2 properties included a lot of houses, farms, churches, businesses, schools, districts, and residential neighborhoods. These are shown on this map as parcels in dark blue. And you can see how this map compared to the Phase 1 map, we were able to survey a lot more in places like Stedman and Linden. So the results of Phase 2 were documented in survey site files, where we completed kind of a short form about each type of property that we surveyed. And those records are kept at the State Historic Preservation Office, and those findings will be summarized in a report, which will be forthcoming from the Preservation Office as well. Though we continue to expand on themes established from prior architectural surveys in the county, such as we continue to find these buildings from the 1800s that had yet to be documented, such as this one on the bottom left, the George Fennell Bryant House in the Beaver Dam area.
That's your question.
That wasn't the damn question.
Phase 2 of the survey greatly expanded on the amount of 20th century properties surveyed. Themes we explored include the development of residential neighborhoods, particularly in the decades after World War II, to address increasing populations and need to house GIs, especially those stationed at Fort Liberty. So that is pictured here, the top right. That is Roop Street in Spring Lake. And then we also documented more of the county's industrial past, including textile mills, but I also surveyed a neat little brick company that used to be known as the Ideal Brick Company that was in Slocum, which is in an area kind of south of Linden. That property on here is this top right. And this is a 2-story brick house that was built by the owner as a residence for his family, but also a showpiece for his product. And there's brick kilns on the property dating from the 1940s. And I was also finding newspaper articles that they were providing bricks for things like campus buildings at Campbell University, and a lot of Piggly Wigglies. Very important. Finally, we surveyed 17 schools in Cumberland County that were 50 years or older, 14 of which are still owned by the school district and operate as schools today. So we ended up covering a really broad amount of history, covering from like the one-room schoolhouse days to the establishment of a formal countywide standardized education system and the eventual racial desegregation of that system. So the schools documented range in age from a circa 1920, it's now a house, but it used to be known as the Antioch Colored School. It was a 3-room Rosenwald Fund schoolhouse. And then to the most recent one, Howard Hall Elementary School, which was constructed in 1980. Pictured in the bottom left is Armstrong Elementary School in Eastover, or at least it's now known as Armstrong Elementary School, but the oldest wings of it date from 1945, when the building was the first African-American high school constructed in the county outside of Fayetteville. So what's next? Architectural surveys are the first step toward listing properties on the National Register of Historic Places. We call these properties that meet the qualifications for listing eligible, and in North Carolina, they organize eligible properties onto what's called a study list. I recommended a few properties for the study list to the North Carolina State Historic Preservation Office, including the 4 that I just talked about on the previous slide. And when a property is listed on the National Register, there's opportunities that open up for the owners, including federal and state tax credit programs and grant funding to help rehabilitate these properties. And then your survey results also serve as the basis for future local preservation initiatives, namely the creation of local preservation commissions, either at the county or municipal level. I will say that like municipal level preservation commissions are a lot more common than county level, but it's not totally unheard of. A preservation commission is overseen by a planning professional, usually with a background in preservation, who also oversees a committee of volunteers with a variety of backgrounds and experience, but with special interest in historic buildings. Local preservation laws are more powerful than just the National Register alone. And namely, I emphasize that a lot because being on the National Register doesn't necessarily prevent a property from being demolished, because it would be seen as an oversight from the federal government if it did. But local preservation commissions can have things like demolition by neglect clauses to prevent people who may own a historic property from intentionally like mothballing it and leading it to demolition. So on this slide, I specifically call out Spring Lake because I believe out of all of the municipalities I looked at, they're really poised the best for a local preservation commission, partially because there's a little bit of energy in the town for establishing one. I talked to an owner of one historic property I surveyed who is actively working on this, and I made some recommendations to him for how to get along with it. But also Spring Lake has a few properties in their town that their Board of Commissioners has designated as local historic landmarks already. So that's really all I have for you today. I'd like to open the floor for any questions. I have business cards with me and also copies of this presentation and the map that I'd be happy to provide anyone who's interested in. Thank you.
Thank you for the presentation. I'll open it up to commissioners if they have any questions or brief comments.
I've got one question.
Commissioner
Yeah.
Adams, you're recognized.
Thank you. Because when you started, you said you did everybody but Fayetteville and all of that. But on the schools, did you do all the schools? Because Howard Hall is in the city. Is it not in the city?
Howard Hall is like right on the border with Fayetteville, so it's like just over the line. Okay. Yeah, so
Real close. Okay.
yeah, we just did Cumberland County schools that were in that survey boundary. Yeah.
Okay.
So the city of Fayetteville has been surveyed quite a bit, and I believe it's like the city government that decides when those surveys happen. Yeah.
Anything else, Commissioner Adams?
No.
Any other comments or questions from commissioners? County Manager Greer, I understand we don't need any action on this.
No, this is just for presentation and information only.
We appreciate your information
Yeah,
update.
thank you.
All right, we'll go ahead and move forward in our agenda to item 3, consideration of agenda items. The first item, item A, is logos for Miller's Brew at Cafe West.
Yes, I'm going to turn this over to Assistant County Manager Faith Phillips to present this item and get feedback from the board. Well, this is a recommendation from the board.
All right. Thank you, County Manager Greer. I'm a little bit shorter. There we go. All right. Good afternoon, Chairman. Good afternoon, Commissioners. So I'm here today to seek your approval or your recommendations for a logo for Miller's Brew at Cafe West. But before we talk about logos, I would like to give you a brief update on the project. So just for your awareness, the Miller's Brew location is in a cafe space that was built at West Regional Library on New Century Circle back in 2011. Previously, the space was being used as storage, so we are very excited to be able to use the space for its intended purpose. And kudos to those who built it for their foresight for what the future would hold. So Miller's Brew at Cafe West meets this board's priorities for fiscal year '24 and '25 strategic initiative to provide paid opportunities for job development and training for young people in our community with special needs. So as you can see from the picture, our space is in the process of being transformed. We've got murals being painted on the wall in the lobby and in the cafe. Espresso machines are being delivered. I think a point of sale system is being delivered as we speak. And so Miller's Brew hopes to get in the space to begin getting it ready and training next week. We hope to have a grand opening in February. So before we talk logos, I want to talk about considerations. And I have to take a moment to thank our PIO team for the graphic design of these options for logos. So when we looked at the design, we considered continuity with Miller's branding and with our Cumberland County branding. This was in the typeface, the colors scheme used, and we also considered the ease of the logo to fit on a coffee cup. So here are 3 options for your review. They're also in your packet. But option number 1, our first option brings in Miller's branding as well as the Cafe West name, our county colors, and a coffee cup and a book. This was the folks from Miller's Crew. This was their first choice option. Our second choice here is much of the same, but there is yellow brought in instead of blue. And then our third choice is the same on a white background. So those are 3 options just to either for your approval or to begin conversations. And so with that, I look to you all for either recommendations of updates and changes or approval of one of the selections.
Thank you. I'll open it up for comments or questions from the commissioners. Commissioner Tyson.
Thank you, Mr. Chairman. Was there a preferred logo that was selected by our Miller's Brew partner, or is there a preferred logo that the staff would recommend out of the 3?
So that is a great question. When I sent this to the Molnars, who are Kim and Carl, they are the CEO of Miller's, theirs was option 1.
Follow, go ahead.
And the staff?
I think it varies in preference for the staff. I think the variation may be between options 1 and 2.
I think the staff will go with what you will commission.
That is a good
I find it
answer.
interesting the commissioners are approving a logo like this, but that's another comment. Anything else, Commissioner Tyson?
No, thank you, Mr. Chairman.
Commissioner Adams?
The problem I have with all 3 logos is that everybody in Cumberland County don't know what Cafe West is. And it doesn't give you, it's at the library. And even though we can see the logo in the coffee cup, people still won't know that it's Cumberland County. I think we want the citizens, all the citizens, to be able to understand where it is, what it is, to be able to do that. So I would think we want to put something with West Regional Library on there, or Cumberland County on there, because make sure, let me ask this question though, because that thing down at the bottom is not a part of the logo, right? No. Okay, just wanted to make sure.
Yes, sir.
Okay.
The logo would be just kind of
Right.
blue area.
And so it gives you no reference to Cumberland County, to West Regional, or any of that. And I think that, when our folk travel all around, we want, I think, all of the citizens to know that it sits out there. That would be one of the issues that I would have with, all 3 of the logos. I think it just it would need to be something that identifies, because if I ask anybody what Cafe West is, they may or may not know where that is.
Anything else, Commissioner Adams? Commissioner, or Vice Chairwoman Jones?
Thank you, Chairman. By any chance, I know these are the options, is it open to doing something a little different?
Absolutely. I'm here today to either seek approval of one of the options or your recommendations.
Can I make a,
Go ahead,
I'm sorry,
follow up.
thank you, yes. Can I make a recommendation?
Absolutely. I'm here to...
I do agree with Commissioner Adams that I feel like there should be something that says Cumberland County and then location, and then maybe another idea. It seems very long as far as, like a business card, perhaps the logo in itself and the words I just think like it's a long banner. Maybe you go back and do a different type of design that might be a little bit more appealing and smaller. That, to me personally, looks like a business, no disrespect, but it kind of looks like a business card. And I just feel like maybe they can come up with something else and definitely add in the location and maybe make it smaller and a different type of shape. And then maybe perhaps too, since I know that represents coffee, maybe something with a little bit, I actually do like number 2, a little bit more color in it. I do like the coffee cup and of course the book, that looks nice, but just, that would be my recommendations. Perhaps a different shape, not as big to look like a business card, and definitely something to also add in location in Cumberland County. That's my only recommendation.
Anything else, Vice Chairman? Anything else?
No, thank you.
Commissioner Tyson?
Chairman.
Thank you. A couple of points, I guess, for clarification. This is basically brand identification for the location itself to be utilized there and for the branding, to create a brand.
Correct.
So we'll still have all the information on Google, on the website. If somebody wants to Google Cafe West, Cumberland County, they would still be able to access all that and know and get further information. So this really is just a brand identification for this particular partnership. Is that correct?
Correct. So really what we're looking with this is to see the direction that the board would like to go with the logo so that we can start doing signage on the building. And then that will help us with the, like I said, the signage on the building, the signage at the street, and then, the placement. So think of this, I imagine this like a coffee collar. So, is this what our coffee collar looks like? What do we want first? What do we want where? What do we want to be on it? So really seeking those for the signage that we put there and then what we can use in marketing. Keeping the continuity of Miller's branding and Miller's font, but also taking and seeing what our standard is and what our goals are, or what the board's goals are for what this would look like and what message it conveys. Does that answer your question?
Yes.
Other questions or comments from the commissioners? Go ahead, Vice Chairman.
This is the last thing. Thank you, Mr. Chairman. Can you see if they can mock something up maybe in the shape of a coffee cup or round shape instead of the long shape, just for visual? Just throwing that out there as a marketing point.
And I hear Diane typing too, so.
Anything else? Anything else?
No, thank you. That's it. Thank you so much, Mr. Chairman.
So I think, try to capture the input that you heard from the commissioners and see if y'all can take that and bring it back. I would just say, my real day job, I do this, and this logo by committee makes my skin crawl. So I'm just going to try to give you as much information as I can. What I heard is a couple different options, maybe something that's smaller, something that has location centric, so something that defines the location, color options, and then maybe even something with a coffee cup kind of a background. I think we maybe get a couple other options. I'll let you work with the county manager when you bring it back. If it needs to come back to this board for final approval, we can discuss that as well. I'll take that recommendation, county manager. Did I capture that, board? Okay. Does that give you what you need?
Yes, it does.
After Commissioner Tyson's information, kind of make mine, I kind of understand now what it is, so, okay. So you can kind of work mine in there so you don't need to have quite as much. I thank you for that. Okay.
Does that give you enough direction?
It does. Thank you all so much. I'll bring it back.
All right. We'll go ahead and move forward to item 3B, request for qualifications for engineering service for sewer projects.
Yes, Amanda Lee will present this item. As you remember, earlier in the work session, we discussed as a part of the audit some of the metrics regarding the Norcross system. This request for qualifications is partly part of that, is trying to find a solution for the Norcross system. That's it, right? Yeah, Norcross system and other sewer areas within the county, Braggart Straits also. Amen?
Yes, thank you. So on December 5th, we posted and invited qualified engineering firms, experienced with a variety of design, preliminary engineering reports, and construction administration of sewer projects to submit a request for qualifications. And we received two qualification statements. One was from Myers Engineering, PLLC. One is from the Wooten Company. Both qualification statements were impressive. Both firms showed their capability to do the work, but we felt like Myers Engineering was the best qualified firm, given their experience for many years as an owner and their extensive operation experience. So our recommendation is to accept the selection of Myers Engineering as the best qualified firm and to grant permission to enter negotiations for detailed scope of work, cost of services, and to prepare a contract for approval at a future Board of Commissioners meeting and authorize the contract manager to execute the contract. And we're asking that this be placed on the January 21st, 2025 Board of Commissioners agenda as a consent item.
Any questions or comments, Commissioners? Commissioner Tyson?
Yes, thank you, Mr. Chairman. Do you have a copy, or can you provide the board with a copy of the point system and the rating system that was used to achieve the result? I see what the end result was, but how it was arrived and kind of what each category was weighted at in terms of what you were looking for in terms of the recommendation?
Absolutely. It was in the request for qualifications. So we'll be happy to provide you with that request for qualifications and that scoring panel. Would you like to have that in the package, I guess, for the next meeting? We can add that?
Yes, if we move it forward as requested, we'd request that you add that piece into the packet when it comes forward for a final vote.
Okay, all right, thank you for that.
If that's the decision of the board.
Okay.
Any other questions or comments? If not, I would entertain a motion. Anyone?
I'll make a motion that we accept the selection of Myers Engineering PLC as the best qualified firm for the engineering services for sanitary sewer and grant permission to enter negotiations for a detailed scope of work, cost of services, and prepare a contract for approval at a future Board of Commissioners meeting and authorize the county manager to execute the contract.
Second.
So moved and seconded, I would add that bring it back at the 21 January meeting, not on the consent agenda, though.
Item of business?
Item of business.
Okay. Item of business.
Yes, sir.
Or did you want it on the consent?
Would Commissioner Patel consider a friendly amendment that, subject to the supporting documentation being provided to the board?
So you can accept it or not before I make a comment.
Yes, I'll accept that.
So real quick, before, just so we got point of clarification. So it's going to come back, it's going to have that information. We can leave it on the consent agenda. If the information is not there, we can pull it, or if the information, we need to have a discussion about it, we can pull it off and move it to an item of business. So the information will be there. Is that acceptable to everyone? Any other discussion on the motion?
I just point out that typically, if it's a unanimous vote, we put it on the consent agenda. If it's not unanimous, we put it on item of business, unless it's an item of business anyway.
Right. That's why Commissioner Fairclough tried to clarify that. So we're going to put it on the consent unless we see something, the RFP information will be in there. If not, then we'll move it off of there. Any other questions or discussion on the motion on the floor with the friendly amendment? If not, I'll ask for your vote. All in favor, raise your right hand. All opposed, like sign. And I don't see Commissioner Council, that's unanimous. Yeah. We'll go ahead and move forward to item 3C, Grays Creek Infrastructure Stopgap Measure for Grays Creek and Alderman Elementary Schools.
Yes, Chairman, on the December 10th meeting, you instructed me to explore deep water wells for the Grays Creek Elementary and Alderman Elementary Schools in Grays Creek. Amanda Lee, along with Mary Bryce, are here to present that information. We have 3 options. We would like to get your recommendation as to those 3 options, and I'll provide some feedback after the presentation and any questions that you have.
Thank you. Good afternoon. It's nice to be with you today.
Afternoon.
Let me move forward here. So again, I'm Mary Bryce. I'm with the county's consultant, HDR. We've been consulting with them on water supply development issues in the county. And as the county pursues its larger objective of providing developing a county water system, today's presentation is to focus on near-term water system options for Alderman Road Elementary and Grays Creek Elementary. And I believe you have these slides. There are a lot of numbers, abbreviations. Please don't hesitate to, ask for clarification. And I don't mean to, baffle anyone by anything that's presented here. The first thing I wanted to start with was a discussion of capacity, because as we always look at when we're talking about water supply, we want to make sure that we're meeting the needs of whatever facility we're supplying that water to. And so the county, a couple of years ago, commissioned a study of groundwater resources in the Grays Creek area. And this table represents sort of 3 of the water-bearing areas that are in the Grays Creek area. I've kind of broken them into the area where the schools are at, and some of the information from the existing groundwater wells that serve those schools. And before I guess sort of march through the table, let me just say one thing about capacity and yield and our use of those terms. In this context, where we're talking about capacity, we're essentially defining how much water do each of those schools need to sustain them. And so that's that range. Grays Creek Elementary is a bit smaller than Alderman, not a whole lot, but those are those ranges. They have existing wells that are in what we call the surficial aquifer. They're about in the range of 80 to 84 feet deep, and they can provide 60 gallons a minute, which is well above the need there, so an ample water supply. One of the aquifers that the county has been investigating that is from the study that was performed a couple of years ago was identified as a viable source of public water supply is the Black Creek Aquifer, and the county has pursued a test well program, and this is some data from a couple of the wells that have gone in as part of that test well program, just so that you can see the relative depths and the relative yields. Obviously, a lot more water from those wells. The study also addressed what we call the bedrock aquifer, which are deep wells. We might call them deep wells. Sometimes these wells are used in the area for residential purposes. They're not often used for anything that requires a lot more water capacity than a residential home might need, because we have found that the yield from those wells is highly variable and very unreliable. We did pull some well construction records from 4 locations that are in the vicinity of those schools, and you can see that, there's one that's as low as 12 gallons a minute and one as high as 30. The bedrock aquifer is really not seen as a reliable source of public water for the schools.
but it is used elsewhere. I'll move on then, and we can talk about water quality. So moving from water quantity to water quality, that table has a lot of data on it, but we've kind of broken it in to try to illustrate some of the water sources that are available in the area. Again, the current wells have been sampled several times by the Department of Environmental Quality and other investigators in the area to track water quality at those schools, and those data are presented along with data that that has returned to us from the test well program that is ongoing, and also data that Fayetteville PWC, who is a potential future water supplier to those schools, their water quality data is posted on their website, and they do have a project underway which will remove some of these PFAS compounds from their finished water. But that data is provided here. And really, kind of the takeaways from this are that one thing I didn't define for you is this term MCL, which is the maximum contaminant level, which is a relatively new rule passed down this past April by the EPA. And so that right now is sort of our benchmark, our regulatory benchmark. And really what this is illustrating is that right now, currently, none of those levels are exceeded at the schools currently, and we do see some exceedances in the other two water sources. And that, unfortunately, has all been a common occurrence in the county, and that's why we're talking about development of water supply sources. Any questions from any of that information before I plow on?
I don't even know if I understood what you said.
Do you want to entertain questions now?
I'm happy to.
Well, why don't we go ahead and move through, and then we'll take questions at the end.
Very good. All right. So here we're going to essentially lead with the punchline. We did look at 3 options for an interim measure at the schools to provide water there. Option 1 is using the existing wells, which we know provide an ample supply of water, but adding point-of-use water treatment systems. The second option is the same, maintain the existing wells, but add a point-of-entry treatment system, and we'll talk about the differences between both of those. And then option 3 is to install these deep bedrock wells, and we'll talk a little bit more about that as well. But this is sort of the summary. You'll see this again at the end of the presentation of, sort of an estimate of schedule and relative capital costs for those 3 options. So that option, point-of-use treatment, and again, unfortunately, a lot of folks in Cumberland County are familiar with these terms, point-of-use treatment and point-of-entry treatment. The point-of-use treatment systems are a reverse osmosis system. It's something that removes PFAS from the water. The unique thing about the point of use is that they're installed on individual plumbing fixtures. So for instance, at a school, you could choose to install them on all of the water fountains, or all of the water fountains and the kitchen sinks, or you could put them on all of the plumbing fixtures if you cared to. So those go inside the building on individual plumbing fixtures. It's really a plumbing modification. It will take some plumbing permitting, but this is not something that takes state water system permitting. So the schedule for that can be relatively short. Again, unfortunately, vendors in the area have a lot of these units, and they're readily available, and so it's a matter of understanding exactly how many. To develop this cost, we assumed that 12 point-of-use systems would be installed at each school, so for a total of 24 point-of-use systems, and then that is what led into the development of that capital cost for all of that of $90,000 to $115,000. So option 2 is also treatment of the existing water, but this is treatment right at the source. So the water comes out of the well and it goes into this treatment system, which and then all of the water that's entering the school has already had the PFAS removed from it. Those filters, that system is typically granular activated carbon. Again, it is readily available, largely. The schools right now have some treatment on them because of iron, and they have some disinfection. And the type of iron removal systems that are at the schools right now do not really play nice with these kind of point of entry systems. So part of the cost of this would be a replacement of the current iron removal system and the disinfection system with something slightly different. Still effective for iron removal and disinfection, but just a different mode of treatment that is more compatible with the granular activated carbon. This has a little longer timeline because it does require permitting through the state public water supply unit. It would require some electrical and permitting modifications. We're also assuming that because of all of these treatment units, that we may need to boost pressure once we get into the school so that all of the school's plumbing fixtures function correctly. And so that is what, again, this would be this type of point of entry system at each of the schools in total would be in the $200,000 to $245,000 range. Option 3, again, are those bedrock wells, and I just want to again add this caveat that it really is unknown that whether the bedrock aquifer could meet the water quantity requirements of the schools. And we really do not have a lot of well-developed data on the presence of PFAS in the deep aquifer, in the bedrock aquifer. It is possible that you could put in, say, a 500-foot deep well and either not have enough water or have water that would still have you wanting to add a point-of-use system or a point-of-entry system onto it, so which could really make those, costs really explode. But assuming that you did want to move forward with installation of a new well at that depth at each of the schools, that is what this estimate is based on. It would also take permitting through the state public water supply system or unit. And so that's what creates sort of a longer time frame, and again, as I said, the high cost. It's a deeper well, and there's more permitting involved. And so that brings us back to, again, the summary of those 3 options, and I am happy to talk through any of it with you.
Before we, anything you want to add, County Manager?
No, go ahead and answer questions.
Yes. I'll open up Commissioners' comments or questions. Commissioner Tyson?
Yeah, thank you, Mr. Chairman. I got a couple questions. One, and thank you for putting together such a good presentation. My first question would be on the cost assumptions that you had for each item. Do you have a breakdown you can provide of what you estimated for example, the cost of the pressure pumps for option 2, the electrical estimation? Can you provide us with a little bit more detail about how you came up with that cost segregation?
Yeah, so these are planning level estimates that we use for capital planning for municipal clients. There might not be exactly the detail that you're looking for, but we do have them by each element, and we can put additional information together for you, certainly.
Next question, the wells that you had, if we go back to slide number 3, which has our existing wells on it, you break down with the Black Creek Aquifer and the Bedrock Aquifer. And you said you had 2 of the wells that you pulled the yield from and the depth that were in the Black Creek. Can you provide what the uses were associated with those 2 wells and what they were being utilized for?
Those are test wells, the Black Creek Aquifer wells, sir?
No, I'm sorry, the Bedrock Aquifer.
The Bedrock Aquifer wells, yes, I have the individual, I didn't want to put the individual addresses on them to protect privacy, but I can provide, I can follow up with you on the...
Is one of them being used for a campground and a restaurant right now?
We could plead the 5th on that.
And you know what my next question is, because I know you said that predominantly you look at it for a residential use, but I happen to know that there's one that's being used for commercial purposes.
That's right.
Meeting that capacity.
That's right, and they are, correct. And these, one thing that we did on here is we did select ones that were the nearest that we could find to the schools themselves. There are bedrock wells farther, especially on the east side of 87, between 87 and the river, that have much higher yields in the bedrock aquifer. I believe that there are also, one of these may be serving a church, but again, those yields, if I knew that I needed, that we had a school that needed even just 10 gallons a minute, I would want a well that is capable of at least 20.
And that was going to be my last question. Thank you, Mr. Chairman, for allowing me a series. The required capacity that you came up with for the model for the current schools, is that, again, kind of put into your modeling software, or was it actually metered from what the schools had been using with previous history?
There are 2 sort of standards that we use to develop those flow rates. One is the regulatory minimum set by the state, which is 15 gallons per day per seat in the school. In the work that we do, where we do a lot of modeling and water supply planning, we use a little different metric, and that is more on the range of like a point. Well, before I misspeak, let me see if I can refer to my notes. I don't have it handy. But we use a square foot basis, so the size of the school might matter.
And one more question, if I may, if the chair will indulge me. Go ahead. Each option, is important. Did you take into account, or can you provide the board with what the ongoing maintenance estimates would be to maintain those systems long-term?
I can, and yes, and I have developed some of those. I can share that with you. I don't have it on a slide, but one thing that I would like you to think about is the timing of how long these units might be in place. That's a factor. And again, going back to that idea of point of use system, how much coverage do you want of the plumbing fixtures in the facility? Because one of the big expenses driving that are the laboratory fees. Once you have one of these systems in place, you do want to be sure that it is ongoing, providing the removal of the compounds that you're trying to remove from the water. And so periodic sampling is needed. Now, when you have a point of entry system, you take one sample, send it to the laboratory, and you're done. If you're having to go, if the laboratory costs are the same per sample, whether you're just taking one or you're taking 20. And if you're doing that quarterly, the laboratory fees really begin to add up. So I will share that information with you, but that's just something to think about, is that those point of use in place for the long term, those monitoring costs can become quite costly compared to just the larger capital cost and lower O&M cost of a point of entry system.
Promise this is the last one. Go ahead. The 4 bedrock wells that you gave us an illustration of here, were you able to either engage with the users of those to see if they had water quality reports, and/or did you consult with our internal county folks, not to see if the PFAS was present, but what the water quality itself? Because I know our county does water quality testing as well, and when the well is commissioned, part of that commissioning process is that you have a water quality sample that is pulled and analyzed. So on these 4 wells, did you look at those water quality reports or ask the owner for a copy of them?
No, we haven't. We haven't approached the owners of those wells. Again, trying to keep.
Thank you, Mr. Chair.
Vice Chairwoman Jones.
Thank you, Mr. Chairman. My only question is this: I know that you all do a lot of marginal and metric studies as well as the required capacity. So my question would be, in between the Black Creek and the Bed Creek, are there any comprehensive studies that would show the pros and cons between the two when it comes to as far as longevity? Pros and cons of, the greater need or not between the two of those. Do you all have any study works that show that?
I do think that the study that was commissioned by the county in 2022,
That was the hydrogeologic framework for Grace Creek in 2022, yes.
That's right. And that report does a great job of outlining which water sources, groundwater sources, are suitable for, again, we were specifically targeting a public water system or any public uses.
Okay, one more question. So in regards to like this particular, I guess what I'm stating, and I appreciate that, this particular study, is there any studies, like if someone was in the same situation, say in another area, doesn't necessarily have to be in North Carolina, has there been any study to show that one over the other was more beneficial?
Well, these are conditions that are very unique to each location. So if you were in even a different part of the state, even in a different county, you would likely want to commission a study for that specific area. It doesn't always translate from one area to the next.
Okay, thank you.
Anything further? Any other? County Manager, go ahead.
Did you all have any other questions?
Any other questions? Commissioners, go ahead. Commissioner Patel.
Thank you for the presentation. I just have one question. For the ongoing maintenance costs, can you forward or share the actual lab testing fees for us?
Yes,
sure. Anyone else, any other commissioners? So a couple questions, and I'll give it to County Manager. I just got a couple questions. So when you, looking at option 1, you estimated 12 POUs, there could be more. So it's really about $9,000 per POU. So if there happened to be, we want to make sure you had complete coverage in one of the schools, it could be 30 POUs.
Correct. Yes.
Was the number 12 and 24 or 12 for a reason?
We actually based it off of a similar experience in Randolph County. They're going through this similar type of installation. In fact, I can share with you that this is an elementary school in Randolph County, and they are installing point-of-use systems as a stopgap measure while they get their point-of-entry system established.
So the point of use allows us, it basically is what we're seeing on the private well owners level with what we saw with the consent order with Chemours, is you've got RO systems and GAC systems. This is going to be an RO system, so we're going to basically, an under-the-sink system that is going to be a short-term solution. We need to capture that maintenance cost. So our anticipation is if we're running, and I'm kind of just talking a little bit, if we're running the lines that we are working towards now, the agreement that we're working towards now, this is a short-term gap so that the children at those schools could actually use the water fountains as they are now, as well as the other water that is coming into the facility. That's a yes.
Yes.
So this could have been done 4 years ago. Sorry, that's commentary. Vice Chairwoman Jones.
Thank you, Mr. Chairman. I'm glad that you mentioned that. I think that's what I was getting at earlier. Since it's a similar situation but different, can you tell me, please, in their situation, which well system are they using? That's what I meant by can parents. Is there some other area that's going through something similar? So Rudolph County, I don't know which options they had, but can you tell me which system are they using?
Yeah, so they are using, again, they've installed the point of use systems while they are in the process of permitting and preparing to install the point of entry system. But they're in a remote area, and I don't believe that there are any plans to extend public water to that school.
Okay, so they're not using any of these, like that Bedrock or any of these? That's what I meant by that. Any of these specific ones?
They are using their own groundwater well.
Okay. Okay. Thank you so much.
Yes.
Commissioner Patel.
Just to piggyback off that question, what type of, so as they have a stopgap for right now, they're going to use the point of use, but what's their eventual point of entry plan?
Yeah, very similar to what we've presented here, the granular activated carbon. And I don't know about the rest of their water quality. They are pressure boosting. I'd have to go back to my notes about whether they have things like iron. It's a different part of the state, a little bit higher up in the Piedmont.
Thank you.
Vice Chairman Jones.
Thank you, Mr. Chairman. So from what I'm hearing then and understanding, I know you don't have the notes on theirs, it sounds like to me, though, that theirs would be very similar. I mean, correct me if I'm wrong, but if they're using existence, it sounds like to me that they're going with something similar to option one because this option one says existing wells plus point of use treatment. I mean.
Correct. They're using actually, they are using option one in the near term, and their long-term solution is option two.
Okay, thank you. I just wanted to make sure I was articulating that correctly. Thank you so much.
To piggyback on your comment about this being done 4 years ago, what is the reason the school board hadn't already taken this up and taken care of this? Why is this being put on the county commissioners?
We reached out to the school board and we didn't hear back. We reached out to the school board and we didn't get a response, but we'll keep pursuing that.
Anything else, Commissioner Fairclough?
Yeah, well, I mean, we're reaching to them, or are they reaching to us?
No, we reached out to them.
What is the school board doing now? What are they doing about the water at the school? Just
It's the
still
county.
bringing in bottled water?
Bottled water.
Really?
At the Grace Creek Elementary School, they received the bottled water covered under the consent order. At Alderman Road Elementary School, the school system is bearing the expense of the bottled water because of the water quality.
They hadn't looked into doing any of this. Okay. Interesting. Thanks.
Commissioner Tyson, go ahead.
I was going to make a motion.
Let me go to the county manager before we do. Go ahead.
As we propose these options, it would be my recommendation, when you look at the top of the capital costs related to all three options, we have an option that's for 2 to 4 months. That would be a quick fix, but I still think that we need to explore options 2 and 3 to make sure that we have enough yield and/or we can satisfy the request of you all and the request of the elementary schools. In that vein, I would request that we be allowed to explore all three options, because at the most, if you look at the high end of the capital cost, it's approximately $700,000. If we start with the 2 to 4 months, it gives a simple solution, whereas we investigate solutions 2 and 3. If we get 2 and 3 within the next 7 to 12 months, that provides water as requested over the next year to 2 years. Now, we have had conversations with PwC. I think things are moving along. I think there are other options based on our PER and how we have that worked out, that at the most, if we do options 1, 2, and 1, 2, or 3, we will have this done within a year, year and a half, but we'll also have our PER and have our connection point with PwC within the next 2 to 3 years. So we only have a 2 to 3 year exposure. So I'm saying let's go ahead and look at it comprehensively. Let's do the 2 to 4 immediately to address the need, evaluate either 2 or 3 to make sure which one evaluates, which one works out as best as we work with PwC and move forward. Our exposure at the most right now would be probably with the $600,000 in cost, along with the O&E or the maintenance, would probably be another $500,000. So we're looking at the maximum exposure of probably over a year, maybe 2 years, approximately $1.5 to $2 million. In the future date, and I could provide some information, we have funds fiscally at a capital level in which we can address this over the next 2 years.
Any questions on what the county manager just gave us, Commissioner Adams?
I just have one question, then I'll make a motion. But I think that if I'm not, and we might need to explore, because at one point we had an agreement basically with the school system, PwC, and us to be able to share the costs in that. And so, and I think that's where Commissioner Fairclough was going, is that we at least explore that cost. I think we go ahead and pick it up, but I think that we at least explore that cost. So I would make a motion to recommend all three options, just as the county manager has just laid out.
Are you making
that motion? Yes.
Can you hold that? Did you have a comment before we went to a motion?
Yes, sir. I would just say that, given the information that was presented and what we asked for, that it would be appropriate and proper for this to come back to our infrastructure committee, since we are moving as a board to move things back through our committee. And so to give the county manager time to get the further information that the board has discussed today, and to bring it back and have that committee look at that and give a recommendation back to the board. That would be my comment in my motion.
Well, I gave you a pause to let there be a motion.
I don't have any problem. I'll withdraw mine and go to the infrastructure committee. That's fine. I'll second that motion.
So we've got a motion on the floor that we're going to take all three options based on what the county manager laid out. They're going to give us additional details. We're going to move it to the infrastructure committee. We'll have a conversation on the timeline for that, aggressive more than not. On time frame to bring it back to the infrastructure committee to bring back a recommendation to the full board shortly thereafter. It goes to the infrastructure committee. Does that capture the spirit of the motion?
Yes.
Okay, so motion, second. Any discussion on that motion? Vice Chairman, did you have something?
No.
Any discussion?
What timeline are we looking like for the infrastructure committee, ideally?
We're gonna, County Manager, when do you think you can bring back that level of detail to the infrastructure committee? We're gonna have our first meeting probably next week. There'll be one routinely each month, so you'll have one in January and one in February.
Next week.
Okay, that's what I thought. So okay. We don't need to add it in motion. I think we've given the direction to the county manager to bring it back in quickest haste.
on the 21st.
Okay. Any other comments or discussion on the motion? If not, all in favor of the motion, raise your right hand.
Commissioner Council?
All, I believe that's unanimous. Thank you. Thank you, board. We'll go ahead and move to the next item, item 3D, authorization to transfer funds to White Flag Shelter Program.
Yes, as we started the White Flag program, we only had approximately $80,000. We needed to transfer some additional funds in there. I'll let Ty Vault, Chief of Staff, present this item and answer any questions that you have.
Good afternoon, Mr. Chairman and Commissioners. Before you this afternoon, as the manager said, to request authorization to transfer $80,000 from the Nonprofit Assistance Program to expand capacity within the White Flag Shelter Program for the remainder of the 2025 winter season. And as you're aware, this program plays a critical role in providing emergency shelter and services to those in our community who are most vulnerable during the extreme weather conditions. The requested funds will help ensure the program can operate continuously throughout the duration of the winter season with adequate capacity, safeguarding individuals experiencing homelessness and housing insecurity. And again, after reconciling existing agreements and commitments, we have identified sufficient funds in the nonprofit assistance project to cover this increase. I'm requesting your approval of this request in the corresponding budget amendment number 250005, and that this item be placed on the board's regular agenda on January 21st, 2025 as an item of consent, and I will try to answer any questions that you may have.
Open up for questions, commissioners. Commissioner Adams, you have the floor.
Just trying to figure out, is the 80 a guess, or did we kind of look at, you better look at the Farmer's Almanac. That seems to be in terms of, yeah, you got that right, determine the weather pattern. Because I just don't want you to come back and have to say, we need some additional funds. So that's I'm not against this, I'm just wanting to make sure that that's enough based upon where this stuff is going and how we're doing it.
Sure, we started back in 2023 when we funded this out of the ARPA committee. It was $80,000. That year, it was a short year, we only spent about $15,000. The next year, we started with $80,000, and then based on the significant number of nights that we've experienced this particular season, we thought that the appropriate thing was to double it, but of course that is invoiced to us, and so it doesn't mean that we'll use the entire allocation, but it's there for sufficient capacity, so if we need it, basically.
So you think it'll cover?
Yes, sir, I do, yes, sir.
Okay. That's all I'm, just to keep coming back doesn't make sense, so.
Anything else?
No, I don't have anything else.
Any other questions from commissioners? Not, I'll entertain a motion.
I'd make a motion to do the $80,000 from the nonprofit assistance project to fund the White Flag Assistance project within that freed up capacity.
And the associated budget ordinance 25005.
Yes, provided.
Second motion. We've got a motion on the floor. It's been seconded. You've got Commissioner Tyson seconded. I'll ask for your vote. Raise your right hand. Affirmative. I think that's unanimous.
Thank you.
Thank you, Ty. We'll go ahead and move to 3E, adoption of policy prohibiting viewing or saving pornography, on county government networks and devices.
That seems to be a no-brainer.
I will tell you that the reason for this is because the legislature buried this in a very lengthy session long. The last session, it was hard to find, but it's a statutory requirement now that you now do these things, and the resolution that's included, my recommendation is we put it in the personnel ordinance because the statute requires that you state the disciplinary action to be taken. None can be taken against elected officials or appointees except removed them from office. But I think the way that I've handled it is the most appropriate way with all the statutory requirements. Any other questions?
Any questions from the commissioners? If not, Commissioner Tyson.
Thank you, Mr. Chairman. I make a motion that we adopt the attached resolution entitled Policy Prohibiting Viewing or Saving Pornography on County Government Networks and Devices to amend Section 501 Code of Ethics of the Cumberland County Personnel Ordinance to comply with the new statute, and that this is added to our consent agenda on the 21st.
Second motion.
Any discussion on the motion?
I do have, I do, I'm sorry. I don't understand why, and maybe it's in the statute, if it's a county device, why wouldn't cover everybody? Elected officials, appointees to boards?
It covers anybody using those devices. You just can't take disciplinary action against an elected official or an appointee, someone you appoint to a board or committee.
But I can take them off the board.
You can take them off, except take them off the board.
Well, I mean, so there is a remedy for.
But that is part of that is part of it. I mean, I put that language in there, you would, up to removing them from the board. But you can't take, they're not an employee, you can't take disciplinary action as a result.
Okay, I got you, I just wondering.
I think we got it all covered.
All right. Thank you, Mr. Chairman.
Any other questions or discussion on the motion on the floor? If not, I'll ask for your vote. Raise your right hand in the affirmative.
Unanimous.
Thank you, board. We'll go ahead and move forward to item 3F, grant of utility easement to South River Electric Membership Corporation. County Manager?
Yes, County Attorney Rick Moorfield handled this matter.
South River is requesting a utility easement for overhead electric power line 30 feet in width running along the eastern boundary of Grays Creek Middle School. The property it's about a 43-acre tract. The property is actually owned by the county incident to a refinancing that was done several times now, with limited obligation bonds, which requires the property that's collateral to be owned by the county. It is subject to a lease and management agreement that gives control of the property to the school board. And we have this in place in a few other school instances. And the board has traditionally always treated these properties, even though they're legally titled to the county, as school property. In communication with the school board attorney, he indicates that his board will favor doing this, but they won't do it until January the 14th, in a meeting on January the 14th. And my recommendation is that you move it forward as a consent item to the next regular agenda, after which written consent is received from the Board of Education for approval, subject to such terms and conditions as are directed by the Board of Education. I think we should leave that up to them. And I always, in all the ones we've done in the past, I've always asked for that in writing, so there's never any question about it later. And it's my understanding from the school board attorney that his board will take action on this January the 14th, so as to be able to get it back on the January 21st agenda.
Questions, commissioners? Not hearing any questions. Question, go ahead.
Yeah.
Commissioner Tyson.
Is the easement request for future utilities, expansion of utilities at the school, do we know?
It does not serve the school. There is a proposed very large expansion of lots in Cypress Lakes, which this is going to be for.
Thank you.
Vice Chairwoman Jones, you want to make a motion?
Yes, I recommend that the board move forward for the consent for this to be placed on the next regular meeting, after which in writing the consent is received from the Board of Education for approval, for the subject of which the terms and conditions are as directed to the Board of Education.
Second motion.
Motion on the floor has been properly seconded. I'd ask for your vote. Raise your right hand in the affirmative. Unanimous.
And Mr. Chair, this will be on the 21st if I get that correct. If not, it will be in February.
Correct. All right, we'll go ahead and move to item 4, other items. Are there any other items of business? I'm unaware of any. Okay. If not, we'll go ahead and move forward to item 5, committee reports. ARPA quarterly project and expenditure report as of December 31st, 2024.
Yes, as part of the requirements, we have to have the report submitted by December 31st. Todd Vaught, Chief of Staff, will present the report and answer any questions you may have, but basically we just filed it on time. So we didn't get put in jeopardy of having a compliance finding.
I'll just say, Mr. Chairman, that so the report is due quarterly, and so the quarter covered the period from September 1st through December 31st, and so I submitted the report on December 31st, and I'm just happy to report that we have obligated all $65.1 million of our ARPA funds, and so that means we don't have to send any back to Treasury, and so that was the first hurdle. The next hurdle, of course, is we have an expenditure deadline of December 31st, 2026, and so we're working on that as well as ongoing compliance to make sure that we have records that we can retain until December 31st, 2030, under which time we can be monitored at any new point, but excited to report that information.
I don't think we need any action, correct, County Manager?
No.
Okay, any questions, Commissioners? If not, we will go ahead and move forward. Thank you, Ty. Go ahead and move forward to item 6, monthly reports. County Manager?
Yes, I would just want to find out, we send out the reports prior to the meeting. I did want to know if anyone had any questions on the financial report, the health insurance update, the quarterly community development update, the grants update, or the project updates.
Commissioners, are there any questions? I don't think we have any, County Manager, so we'll go ahead and move forward unless you need any action.
No, we'll just move those forward to the 21st
for approval.
For approval.
Okay. We'll go ahead and move to item 7, Commissioner requests. I know these previously had been kind of captured under other items, but we wanted to break it out, and we'll create some framework and guidelines around what that looks like, so from a time requirement and those kind of things. But just moving forward, the first Commissioner request, 7A, boards and commissions, nominations and appointment process. That was requested on the agenda by myself, so I'll go ahead and introduce that or talk about this item. Basically, the boards and commission process, we're looking for a couple things. One, I'm going to ask the clerk to very briefly explain the existing process that we have, and then a recommendation or a framework for a recommendation for what changes would look like. So, Madam Clerk, if you can give us that.
Currently, the boards and commissions, we track it through a variety of spreadsheets. Residents that are interested in serving, they apply online. There are no supplemental questions and no ways to upload the resume on the current application process. And I did provide a copy of the application to everyone. The application is then sent to the clerk and the deputy clerk. IVA goes in and verifies the address that they are Cumberland County residents, and then we add that information to the applicant list. The applicant list is provided to the liaisons for those boards and commissions. Sometimes the liaisons will provide recommendations after that board has met, and we then input that into Novus for appointment, nominations at one meeting and then appointments at the next meeting. The Board of Commissioners are always available to make their own recommendations for appointment. If there are multiple nominees for say we have 5 nominees for only 3 vacancies, then the board conducts a vote and the person with the most votes is appointed. IVA then contacts that board member, and we send a letter from the chair to let them know that they've been recently appointed, and we update the roster and send that to the liaison. We are working quickly with IT when we get our new agenda software to implement some changes with the tracking system for boards and commissions. All those appointed are eligible to serve 2 consecutive terms. After 2 terms, they have to come off the board for at least 1 calendar year before being reappointed. Changes that IVA and I have done since we came on board is because there is no time limit on your application. We are dating the applications in our tracking paperwork, so we know if someone's been on there for a longer period. We've come across where sometimes people who've have applied have moved away or are deceased. So we do not want to have that option keep happening. So things that we recommend is doing some additional supplemental questions on the application process, allowing a spot for them to upload a resume, and then do a time limit on the application so people have to apply annually and not just stay on the list.
Okay. Thank you, Madam Clerk. So From my standpoint, this was brought about as we began to look at the boards and commission process, engage with the deputy clerk and the clerk to better understand some changes that they would like to see and some kind of hangups in the process. Also to better streamline it as we went through and looked at the boards and commissions, the nominations and appointments. A lot of times those get overlooked and we don't capture them in a month period. So I think there potentially are some better ways, best practices that we see in other municipalities and counties that we could potentially implement. And I think in talking to the clerk, the deputy clerk, there's definitely some options that we can do. And so what I'm asking this board to do is just very simply, I want to refer this to the policy committee to prepare an updated policy and procedures for boards and commissions appointment process to bring back to the full board on January 21st. And the reason why I say that time frame is because we've got a series of nominations that have to happen in the month of February and March, and if we're going to make some best practice changes, one of those potentially being, and I don't want to prescribe to the committee, one of those being that we go to a twice or 3 times a year appointment process where there's a committee that reviews all the applications and then moves those forward collectively to the board at set times. And so if we're going to move to something like that, we need to facilitate or speed this process up to make sure that we have a process in place as we're starting this year, and there's a lot of appointments coming. So again, I would make what I would ask this board to do, and I can put it in the form of a motion. I can do that as the chair according to our rules, to refer to policy committee to prepare an updated policy and procedures for board and commission's appointment process to bring back to the full board at the 21 January meeting.
I'll second that.
Any discussion or comments on the motion? Go ahead, Vice Chairman.
Thank you, Mr. Chairman. I'm glad that this is coming about because, as I recall, we are moving forward, but I'm pleased, and I do hear this a lot out in the community, that we need a little bit more positive structured way to do things, and I brought this to the attention to the board a year ago, so I'm glad that we're bringing this forward because we can learn from other bodies of government, so I hope that once this is moved forward and the other committee looks at this, as I had stated prior, I personally like the system that the city has, where twice a year, it makes it a lot easier, because again, I like to listen to the voices out in the community. It just makes it a lot easier when everybody's coming on and off of boards. I get this feedback a lot from the community, stating that it's not that they don't want to serve, but just the confusion, or sometimes it can be done better. They don't know when people are coming off boards or on boards. So that's just my input, that I'm glad we're moving forward to have a more structured and maybe organized, again, because it's all about the community, to help those that want to serve to be able to get that information in a more user-friendly way. Thank you, Mr. Chairman.
Any other questions or comments? Commissioner Tyson?
I was just going to say, Mr. Chairman, I appreciate you bringing this item up. You know, one of the goals is for this commission to always be transparent, and our boards and commissions that we appoint to, you know, really are the eyes and ears for this board to help, you know, give us policy recommendations and to let us know what's going on in the community. So this is a really important issue, and it's important that the community knows that if they do want to give their time, that we're going to take a serious look at their application and give it thorough review. So I applaud you for bringing this to this, and hopefully if this motion passes, then we'll look forward to getting some action done in the policy committee to come back here.
Commissioner Adams?
Mr. Chairman, all I'd ask is that prior to bringing it back on the 21st, if that policy committee could meet early and send it out so that if we have any suggestions, it can get back to the policy committee before we try to sit down at a board meeting and try to pass something. So I don't have any problem with the motion. I just ask that it be brought back, or at least disseminated to all of us, so we can have whatever questions we might have or implement.
Understand. We need to make sure the commission has the input into it. We'll do it at the next policy committee meeting that I believe is going to be set up on the 14th. And then there'll be, all that information would get disseminated out to board members so we could do what we need to do before the 21st.
I just wanted to add that we have reviewed the boards and commissions, and based on what we're seeing as the pattern for people coming off of the boards, we divided them up into fall and spring appointments. And everyone has a copy of that as well.
Any other questions or comments on the motions on the table? If not, I would ask for your vote. Raise your right hand in the affirmation.
Unanimous.
Thank you. Thank you, Board. I appreciate your consideration. I'll move to item B, white flag capacity and expansion of service. I'll recognize Vicewoman Jones, who brought the item forward.
Thank you, Mr. Chairman. I basically just want to request that the staff would look into an actual plan of the cost. I know that we just approved for there to be some money put in there, but my concern is to make sure that we have services that can cover the entire county based on the unhoused population clusters. As of current, my understanding, and if you look at our website, and for those that are listening, we don't have any services put into place across the river and also out towards West Fayetteville. So this is why this request is being made. I would also request that in this plan, when you all come back with information, that in that cost that we include also looking into taking into consideration getting with the PO and communications to see about getting that information out, perhaps in other ways other than just advertising on our website, although our website is great, because some of the individuals that might want to apply for an RFP and that can provide those services, such as nonprofits and churches, many times, they don't necessarily look at our website as they would, for instance, the newspaper, City View. So just please take all that into consideration, and I appreciate it.
Before we move to a motion or an action, I ask if there's any questions or comments around this item.
And I think that that's a great suggestion, but I would also, I think there's one church out in Spring Lake that's trying to do it on their own, that be incorporated in when you look at it in that northern part. We don't engage with them, but they're doing it, and so if we can at least look at that area also, out that way. Thank you.
Did you want to add anything? No. Or County Manager, okay. If not, then Chairwoman, Vice Chairwoman Jones, do you want to make a motion?
Yes, I make a motion at this time that we move forward with the staff's direction to plan and come up with a strategy cost to expand white flag services to ensure countywide coverage based on unhoused population clusters and the areas needed as discussed, Spring Lake, also West Fayetteville, and also that of over the East River area at this time.
Point of information, Mr. Chairman.
Can we, let's second?
Oh, I'm sorry.
Can we second the motion first? Second.
Just point of information to clarify the motion, if that's okay. So the motion we're voting on is to give staff direction to explore this. We're not actually funding or spending any money.
That's correct.
Okay.
So I believe what you would anticipate here is direction to staff to explore the cost. They'll bring it back.
Yes.
We haven't given them a time frame. They'll bring it back to an agenda meeting to give us a presentation and give us explanation of it.
Thank you.
I think it's a timely topic. Any other questions or questions or comments from commissioners? If not, I will ask for your vote on the motion that's on the floor. All in favor, raise your right hand in the affirmative.
Unanimous.
For those of you who couldn't see, that was Commissioner Adams coming back in the room to raise his hand. Thank you, Board. We'll go ahead and move forward. Item C, Sheriff Deputy Retention and Recruitment. I brought this forward, so I'll go ahead and discuss my request and then open it up for questions before I make a motion. I had the Chief Deputy here. Meeting went a little longer. I don't expect him to stay, but I wanted him here in case we had any specific questions around it. And really, I bring this forward. I know this is outside the budget cycle. I think there's some funding mechanisms that we can use to look at how we do this. But I bring it forward because I believe it's an immediate need. You can just look at the latest article that was in City View that talked about, and this was earlier this year, that talked about shortages. We know there's shortages across the public safety sector. I understand that there's a shortage across government in general and government employees in general, but as we look at public safety, specifically in the detention center, 162 positions, 66 are filled. We got over 96 vacancies. And the sworn side of the deputies are shorter about 77 personnel. Again, I believe this is a critical, we look at this critical need from a retention standpoint as well as a recruitment standpoint. I've been able to tour the detention center with the other new commissioners, and I will tell you that this is something we need to address now, in my opinion, and it's a critical need for the shortages that are there for not only the safety of our employees, but for the safety of the people that are in the detention center as well. And so what I would ask this board to look at is a targeted bonus pool to recruit and retain detention officers, as well as lateral transfers to sworn officers to get experienced deputies. Because the other thing that we're seeing, and why I asked for lateral transfers, in my discussions with the sheriff and his leadership team, what you're seeing is while they're doing a good job with their academy and BLET and moving people through, at that middle management level, just like we see in a lot of other areas, there's a level of experience. And if we can recruit lateral transfers, we can gain that, somebody that's got the 6 to 10 years experience, and we can inject them into our system, especially as we've got an aging agency that is beginning to, we're going to have some retirements come as well. So a targeted bonus pool that looks at recruitment and retention specifically to the detention officers, to identify and make sure we increase that manning. And then a lateral transfer bonus pool as well. I will tell you that there's some other things that we heard in talking to the detention officers. It's not just money and bonuses, but it's also child care. And I know Assistant Manager Phillips, I know that we're looking at that, and you've done a great job of putting some things in place. But child care is an issue for them, as well as some access to the wellness center and some other things that hopefully we can look at it and address. But this was a targeted way to try to recruit and retain detention officers, as well as have a bonus pool to target lateral transfers as well. So I will open it up for questions of me before I make a motion. I will tell you the frame of the motion is going to be to refer it to the ARP committee, and if not the ARP committee, then we can move it to finance if there's not a mechanism to fund it. And I may be directing it in the wrong area, but I believe that this is tied to our growth of our employee pool post-COVID, and so it meets the criteria. If I'm wrong, we can move it where we need to move it, but I'd like to move it to the ARP committee for an allocation of bonus pool of $150,000 for the detention officer and $200,000 for lateral transfer recruitment, and allow the sheriff to create the criteria for the program. I'm just giving you the framework for what I'm looking to ask before I make a motion. I'll open it up for questions. Commissioner Tyson?
Mr. Chairman, I appreciate that. Before I ask you my question, just wanted to tell you that first and foremost, I appreciate your confidence in me as the sheriff's commissioner and appointing me to that liaison position. I have had a chance to meet with the sheriff as well, and to tour the detention facility with yourself and with Commissioner Patel. And so I applaud the fact that you're bringing attention to this issue, because it is a very critical issue. My question to you would be, what would be the timeline that you would be looking at to get a response back from committee for the board to be able to have something to review?
Committee's on a schedule to meet once a month. If they, at their soonest availability, to make a recommendation from the committee to bring it back to the full board.
Thank you, Mr. Chairman.
Quick haste. Any other questions or comments?
I just have a question. How many employees, and I guess I'll go to, because you got two separate things. The first part is on the detention, because I have to break down to, I don't know if you're doing it equally among all of that, or is there a, because I guess you got captains and all of those, so, and I guess maybe the committee is going to do that, but how many employees, based upon, what you got for the full amount?
So for the detention officers, there's 162 positions.
Right.
There's 96 vacancies. That
Right.
includes your lower rank and file, including your lieutenants,
Right.
captains, et cetera. So there would be, I don't want to prescribe to the sheriff on what they need, but I would say we would allocate $150,000 in a bonus pool that then they can create the criteria for.
So, and I guess my next question is that ongoing forever, or is there a possibility to take those lapsed salaries in that 90 and use that? Because they will be budgeted again. I'm just asking, I mean, because if you haven't filled those positions, that lapsed salary should be there. So I'm just kind of...
Again, the information, great point. There has been some positions cut, so that total lapsed salary is not there. There's been positions cut, so they're funded, but they're not, they're authorized, but they're not funded.
So when you say 96 positions...
No, there's 96 vacancies.
96 vacancies that are funded, though?
Correct.
Right, so there's 96 vacancies that are funded through all that, so those funds are somewhere.
That's correct.
And so that's why I'm trying to figure out, and I don't care where the money comes from, I don't have a problem with that, but I'm just looking at in terms of the budget or whatever, wherever the finance committee does. So if the finance or the op look at it, is you can joint money together if you've got those funds. I don't know how much is there or not there to be able to do. I'm not trying to tell the committee how to do it, but I think, either they roll over or I don't know what happens to them when you don't have these positions that aren't filled. That's a staff kind of thing. We could talk to the manager, but that was the only thing that I'm trying to do.
Great comment. Go ahead.
Go ahead. I got a second part of that.
Great comment on that, and what I would say I would do is why I didn't want to prescribe where the money's going to come from, so probably direct it to finance to work with the staff, determine where the best place to move the money from.
Yeah, I was just thinking that we don't want to just kind of obligate that it comes out of general fund or out of ARP when it might be a combination of all of those and those lapsed salaries. And I guess on the second one, I guess is the amount that you did, I guess that was in talking with the sheriff?
Correct.
Okay, because, I mean, the worst thing you can have is have a program that doesn't fund it enough that you don't get anybody from a lap kind of thing, a lateral. So when you're stealing from other folks, I ain't gonna say that, but when you're trying to entice people over, you gotta have enough money for me to be able to leave where I am, that benefits and everything else, to be able to move to another thing. Because one of the things that we do know is that we're going to be competing with Wake County, Durham County, and all of these other places. So when we look at these funds that you request, is to make sure we got enough to make it attractive enough to be able to do that, because there's no reason to give funds if we can't attract anybody. So that's why I was asking how many on the lateral, because the criteria of how much you're going to give to make it attractive for somebody to be able to do that.
So that input is from the sheriff, that's kind of why I brought it forward, and it's also why I would allow the sheriff to define their own program and the bonus levels and based on where they need people at this year. I don't want to pretend to prescribe them.
And I would ask, that as the committee does that, to engage HR too, because they will have some data for you to be able to do. So I think HR, she definitely needs to be in the room as you have those conversations. Thank you. That's all I got, Mr. Chair.
Thank you, Commissioner Adams. Commissioner Patel.
I just wanted to make a note, Commissioner Adams, speaking to the sheriff and the major at the detention center, for the salary positions that weren't filled, I think one of the issues is they are filling these salaries, but the retention is so low that within 2 years, most of them are leaving. So they are expending dollars for salaries, but they're just not able to hold on to the officers.
Make sure I understand.
So for example, they hired 45 people, 45 detention officers. In the course of a year, 39 of them don't quote me on that, have left.
Yeah, so, but there's still some funds there.
Correct.
I mean, either way you do it, and so I guess the question is, as we talk about retention, is, a bonus is just a bonus. Is it that the salary is not enough to keep them, or, because if that's the issue, I mean, you give me a one-time bonus, next year I'm at the same issue of you know what I'm saying? I'm just saying, so is it a salary kind of thing, or is it a bonus kind of retention? So I don't know.
So you heard me talk about a couple things. I think one, it's a salary, so there's a retention thing, and the bonus is going to help them offset some of these other costs. So childcare is an issue. They can't fund childcare right now, so a bonus will help them bridge this until we're working through our childcare and going to bring some additional recommendations on what we do for childcare at the government level, as well as also as we, there are some other issues. So we can, much like we're looking to do with the water, get a short-term fix and then begin to phase out how we can fix it. But these bonuses will allow them to, it's not just the salary benefits, it's about being able to offset the other costs like childcare.
And I guess I would, and I agree with you, I think it's a great idea, but as we do that, let's look at it for all the employees, because I think all the employees are going to have that same child care kind of issue with that, but I understand the short term on this, but if we can kind of even talk about the rest of them, child care is out of this world. I'm glad mine is grown now. So, Commissioner Tyson and Commissioner Patel. All right.
Oh, I got an 8-year-old.
Oh, that's right, I forgot. You got an 8-year-old.
I'm old.
That's right.
Commissioner Patel.
I forgot. You got all that gray, so I forgot.
Commissioner Patel, you've got the floor.
So the other point I just quickly wanted to make a reference to is we've got officers that are, in pods with 40 to 60 folks that they're walking after.
On my day job, I do understand.
So I think that's one of the recruitment burdens, so hopefully the bonus and lateral transfer money will help.
And I think you make the motion. I don't think anybody's...
No, I haven't made, I'll make the motion. Just my last comment. I understand childcare is important. I tend to continue to have conversations around childcare because it's not just for our employees, it's our workforce across our community. We've got childcare cliff we're getting ready to face in March across this state and across this community, which is something we've got to address. So I understand it affects all our employees, and I'm not singling out the Sheriff's Department, but I believe it's a safety issue. It's a critical issue with our Sheriff's Department and public safety right now. I understand our other employees as well. Let me go ahead and make a motion to refer to the Finance Committee for the allocation of a bonus pool of $150,000 for detention officer retention and $200,000 for lateral transfer recruitment, with the sheriff to create the criteria for the final program. Second. Any other discussion on the motion is on the floor? If not, I'll ask for your vote. Raise your right hand in the affirmative. It's unanimous. Thank you. Thank you, board. And I believe now we will move to item 8, closed session. Mr. Tyson.
Thank you, Mr. Chairman. I move that we go into closed session for an attorney-client matter pursuant to NCGS 143-318-11A3.
Second.
We'll go ahead and move into closed session. Commissioner Tyson, you're recognized.
Thank you, Mr. Chairman. I'd like to make a motion that we return from closed session.
Second.
All in favor for moving out of closed session and returning to open session, raise your hand in the affirmative, right hand. It's unanimous, Madam Clerk, and we are back in open session. There's no action during closed session that requires a vote, so I will entertain a motion to adjourn.
Motion to adjourn.
Is there a second? I ask for your vote. All in favor, raise your right hand.
Unanimous? Who seconded?
I did. Well, he did.